building low carbon, climate adaptive, and resilient health systems. Thank you very much.
Thank you, Crispus. Mwasuze Mutia Basebo ni Banyabo. Ladies and gentlemen, good morning. I'm Dr. Nomthala Zolukele from the WHO Country Office. I'm the acting cluster leader for communicable and non-communicable diseases. I am here on behalf of the WR, Dr. Jonas, who would have loved to be part of this important discussion, but due to competing demands, he is out of country and could not be here. And therefore, I'm grateful for the opportunity to be here, to also tap into these discussions, because as a medical officer myself, this is an area that we are behind when it comes to preparedness, even awareness. So we are grateful for this opportunity for the organizers. I will not waste time. I will read the WR's remarks as they are written. Honorable members of Parliament, Embassy of the Federal Democratic Republic of Ethiopia representative, Permanent Secretary and colleagues from Ministry of Health, colleagues from Ministry of Water and Environment, colleagues from Ministry of Finance, colleagues from UNDP, UNICEF, UNFPA, Red Cross, colleagues from academia, CSO, and NGOs, ladies and gentlemen, good morning. On behalf of the WHO representative, it is my great pleasure to address you today. I am honored to stand before you today to address a matter of paramount importance, the urgent need to support building of low carbon, climate adaptive, and resilient health systems in Uganda. Let us begin by acknowledging the reality of climate change's toll on global health. According to the WHO, between 2030 and 2050, climate change is expected to cause an additional 250,000 deaths per year. This is primarily due to malnutrition, malaria, diarrhea, and heat stress. It is unfortunate that these impacts are disproportionately felt by the vulnerable population in low-income communities, making it essential for us to act decisively to mitigate these consequences. The health sector is uniquely vulnerable to climate change, yet it also holds the key to building resilience within our communities. A health system that is low carbon, climate adaptive, and resilient is one that not only mitigates its own environment impacts, but also prepares for and responds to the health challenges exacerbated by climate change. Allow me to share some specifics regarding the health challenges posed by climate change in Uganda. One is on vector-borne disease, and with malaria as an example. Malaria is a climate-sensitive disease which already accounts for a significant health burden in Uganda. The changing climate conditions, especially the rainfall patterns, has led to a geographic range of malaria vectors expanding, putting more communities at risk. Uganda is also experiencing a heightened frequency of extreme weather events, including floods and droughts. These events not only directly impact health, but also disrupts the health infrastructure and services. The floods almost every displace people and increase in water-borne diseases, highlighting the interconnectedness of climate and health. Changing climate patterns affect agricultural productivity, leading to food shortages and malnutrition. In 2022, WHO announced the Greater Horn of Africa drought response as WHO Grade 3 emergency, with populations in Karamoja facing food insecurity due to climate-related factors. Additionally, access to clean water is compromised, leading to a rise in water-borne diseases with cholera outbreaks. It is evident, therefore, that climate change is not a distant threat, but a present danger demanding our immediate attention. In response to these challenges, it is imperative that we focus on building a health system that is not only responsive to current needs, but is resilient in the face of changing climate. A low-carbon climate adaptive health system is not just a vision, it is a necessity for the well-being of the people of Uganda. Ladies and gentlemen, firstly, reducing the carbon footprint of healthcare facilities and operations is crucial. Sustainable practices such as energy-efficient infrastructure, waste reduction, and use of renewable energy sources can significantly contribute to lowering emissions. By embracing these practices, we not only contribute to global efforts to combat climate change, but also create a healthier environment for patients and service providers. Secondly, the health sector must adapt to the changing climate to effectively address emerging health risks. This involves strengthening surveillance systems to monitor climate-sensitive diseases, enhancing early warning systems, and developing robust response mechanisms. Additionally, integrating climate considerations into healthcare planning and infrastructure development is essential to ensure the sustainability and effectiveness of health services. Lastly, building resilience within the health system requires a collaborative and multi-sectorial approach. Governments, non-governmental organizations, communities, and international partners must work together to pool resources, share knowledge, and implement innovative strategies. This collaborative effort is crucial for not only tackling the immediate health impact of climate change. The World Health Organization stands ready to support Uganda in the transformative journey towards a low-carbon, climate-adaptive, and resilient health system. We will provide technical assistance, share best practices, and facilitate partnership to ensure that the health of the people of Uganda is safeguarded against the impact of climate change. In conclusion, the time to act is now. Let us come together to support building of a low-carbon, climate-adaptive, and resilient health system in Uganda that not only heals the sick, but also protect the health of future generations. By investing in low-carbon, climate-adaptive, and resilient health system, we are investing in the well-being and sustainability of our communities and our planet. With these remarks, I wish you a fruitful symposium. Thank you.
Put your hands together once more for Dr. Namtandazo for such an insightful and very factual presentation. And to me, what stood out in that presentation was the fact that the specifics, where we're talking about climate change, worsening vector-borne diseases like malaria, which is very much climate sensitive, but also talking about extreme weather events. Now, if you're familiar with the news, especially with flooding, you see how the infrastructure is being washed away. So it is not only the roads and the schools that are being washed away, but also the health facilities. I'll give you an example. In Western Uganda, Glembe Mines Hospital was closed by Ministry of Health because of seasonal flooding. And this hospital was serving over 50,000 people in that region. So imagine, where are these people getting health services from? So, and then also how we can decarbonize our health sector in Uganda. They gave us solutions of investing in clean energy or using clean energy sources. So, and then also a call for collaboration, because climate change is a very big topic that as a sector, a health sector, we cannot work on it alone. We need everyone, a whole society approach. When we are, if we want to be sure that we get very good results in our actions. But also they highlight, I want to highlight where they said we have to act now, because most of these things we have been pledging, like Dr. said, some of our partners in the Global North pledged annual finances that up to now have not been realized. So it's the time now that we don't just pledge, we don't just talk, but we rather act. And if we are to act, let us act collectively. And this can be shown by this symposium, how our audience is full of representation from different sectors, CSOs, different government agencies, and private sector. So, I mean, we have to act and act collectively if we are to achieve climate action, especially in the health sector. That being said, I'll invite the representative of our commissioner, the commissioner climate. Sorry. Okay. The representative of Margaret Athieno, who is who is that? Do we first have to do a concert, something? Okay. Mr. Muhammad Semambo, the principal climate change officer in the climate change department from Ministry of Water and Environment. Please, the floor is yours, and he's going to talk about health, focus health from African Climate Summit to COP28. Please. The floor is
yours. Good morning, everybody. Good morning, everybody. My name is Semambo Muhammad, and I work as a Principal Climate Change Officer in the Ministry of Water and Environment in the Climate Change Department, and my task is very simple today, just to deliver a message on behalf of my boss, Mrs. Margaret Athieno Mwebesa, the Commissioner for Climate Change Department. First and foremost, I will start by sending a apology for Madame Mwebesa for not being with you here, because there is also other important engagements actually she's involved in about carbon trading. She has been assigned by President to do some paperwork on that regard, but requested me to deliver the message on her behalf. So, as you note from the agenda, I'll start by appreciating the organizers of this conference, and specifically I saw on the program that there is Adapt, then there is Ministry of Health, I think, on behalf of Government of Uganda, and the World Health Organization. But of course, when you're not here, I think there are a number of partners beyond that. So I will not sing out each and everybody, but I would just want to thank everybody who has made contribution, whether financially or technically, to ensure that we have this symposium. On On the subject which Madam Commissioner might have said, allow me to say that as government of Uganda, we moved ahead of recognizing the importance of health in terms of addressing climate change. Those of you that have been following how our national planning is in terms of addressing climate change, I think health is one of the sectors that we treasure in terms of addressing climate change. And for the reasons which I'm going to just mention briefly. Number one, it is on record that the health sector has been impacted by climate change. You saw what happened with the flooding, most especially in the western part of the country, that one of the infrastructures that were affected is actually the health system, isn't it? There were the health centers that have been affected, but also you note that when we have floods in Uganda here, we have a lot of issues related to the water quality. And when you have issues related to the water quality, the end result is about the health of the people. So that is number two. Number three, it is also important to note that as temperatures have been increasing in this country, there are certain places that were used to be called malaria-free areas, more especially in the highland areas. So in that regard, we've been seeing increase in malaria as a result of increasing temperatures. Specifically when you go to areas like the Chigezi Highland, when you go to the mountain Elgon, some of those areas, those who are old enough, they used to say that they were malaria-free zones. But with the increase in temperatures, there are incidences of malaria that have been reported and have been increasing cumulatively. So that indicates that we have issues to deal with health in relation to climate change. So name it, but we also have others that are related to the choleras that have been happening around the country when we have extreme events like floods, among others. So the health that we're talking about can also be capitalized in terms of the feeding that we have. So when we have a lot of droughts in this country, there's a lot of food insecurity. And the end results, you are seeing issues coming out with malnutrition, among others. But again, we have also issues to deal with brain traumas that are happening. There are so many people that have been borrowing money to invest, maybe in agriculture, but with the increase in terms of climate change, you could see that most of them are unable to pay back these loans because of the climate change. So as a result, it's not only about the health of the issue to do with food security, maybe water, but even others may have indirect implications as a result of climate change. So a number of them have been failing to pay back their loans that they have bought to invest in agriculture, and what happens is the issues of madness and so many other things. So you cannot remain the same when a climate catastrophe has happened. So there are so many things that you can attach to health in that regard. And then I want you to note that the national projections have already made in terms of temperatures and precipitation. Things are not going to be the same. The temperatures are projected to increase in the range of 1 to 2.5 in various areas. So if temperatures are going to be increasing that range, in the business as usual, but looking at the three models, it means that there is also direct and indirect implication that may affect the health sector in that regard. So when the temperatures increase in the range of 1 to 2.5 in various areas, what does it mean in terms of health? I think most of you here are health experts. And then in terms of rainfall, the rainfall is projected to reduce in the range of 5 to 15, that is in terms of percentages, but in various areas. But we also detect that there will be some bit of increase in terms of rainfall, more especially in the southwestern highlands, that is the Chigezi Highlands. But the rest of the other parts of the country, what is being projected is a reduction in terms of rainfall in the range of 5 to 15% in that category. But the Central Cattle Corridor is the one that will be most affected. So now the issue is that, what does that mean in terms of health? And when we talk about health, we are talking about the food, we are talking about the water, we are talking about the human themselves, but also talking about the health of the animals, among others. So, and I will keep on warning people that health goes beyond what the Ministry of Health is doing. It also goes beyond what the Ministry of Agriculture is doing, because we're talking about health for the animals, which the Ministry of Health is not doing because it's not their mandate. We are talking about health of water, and in terms of that is talking about in terms of the quality of water that we're going to be using, and it could be going beyond the Ministry of Health, and then you need to add up all these dots. But also, there are accidents that happen with climate change. We've been seeing a lot of accidents happening with climate change, and the end result is about loss of livelihood, but also loss of lives. So as we talk about health, I think we should open up to go beyond the human health, but also there is other health that could be complicated, and also the accidents that could come or that result from the adverse impacts of climate change. So on the record, when we have the floods, at least you hear people that are being killed as a result of floods. When we have landslides, Climate Change Action Plan, which is the NDC. So when we look at the NDC, we have done high-level impact assessment in terms of vulnerability to climate change. So apart from ecosystems, water and agriculture, I'm confident in saying that health is coming in number 4 in terms of being at risk, but also being vulnerable to climate change. And therefore, that caused that we need to have a special climate change action, that is the adaptation plan for the health sector, that could bring out the details. Like you do the science, you model, you come up with the risk, the hazards and risk that could affect the health. That is the human health, but also the health care systems in Uganda, to ensure that you climate-proof them in terms of planning for them and also addressing climate change in that sector. So it is one of the actions that is required by the Ministry of Health to develop a national health climate change plan. That is the NAP for the health system in this country. So it is that requirement that could also necessitate what we need to do in details as government of Uganda in order to address climate change in the health sector. So that means that you are going to look at a number of things, because some of them could be like accidents on the roads as a result of poor feasibility, others could be associated with water, others could be associated with food that we eat, the diseases that can be manipulated as a result of climate change, and so many other things that may come, but also the resilience of the health infrastructure system is really very important. But we recognize that from the health practices, there's also issues that are related to mitigation. Because the way how you manage the waste in the health sector is very important. The previous speaker has mentioned it. We need to look into that. You talk about how people are cooking and the source of energy that they are using for cooking. They also have health implications. So how do we address all this across all the spectrum? I think it is really very, very important, because most of the diseases, most especially the respiratory diseases, can be coming from pollution. And pollution sometimes related to the energy that we use for cooking, most especially the indoor cooking. So we have so many things that we have to relate to the health sector, but in relation to climate change. So that said, the Ministry of Health, you have around 4 things that you have to address in terms of implementing the national determined contribution, which is the National Climate Change Action for this country. And I'm very sure that the Ministry of Health is on course, because it has engaged us that you are doing a vulnerability assessment for the sector that will inform the development of the health sector for this country. And that one will help to bring out the details of what we need to address. But also, leaving that aside, I would say that in the UN system, the health has not been pronounced in terms of the negotiation. So it is of recent that the World Health Organization, coupled with the AGEN, I think, that is the Africa Group of Negotiators, they saw it wise that we need to bring health negotiation in the UN system. And you could recall, those of you who have participated in the summit, the Africa Climate Summit, that happened in Nairobi last year, that health has been discussed but has not been given the due consideration in terms of the bigger decision making. So at that level, what happened is that the AGN, but also with the high-level ministerial meeting was conducted, and the issue is that how do we institutionalize health in the UN negotiation, and that is in climate change negotiation. So, and I think this is really something very, very important, because on record, if you don't have a thematic area to negotiate under the UN, then that means also the resource mobilization, the capacity building, and the technology required will not be given due attention. So, as Africa, I think it is really very, very important, and all developing countries, that we need to consider a broader institutionalization of the health negotiation in the UNFCCC. Because at that level, you have now a thematic area or a block where you can bring in the issues related to the health that could help to mobilize adequate resources, the required capacity building, the technology which is also required, and then you'll be able to address climate change and health. So in simple terms, this is what happened during the climate summit, which happened in September, that a group of health advocates, government, and key negotiators, they felt that we need to bring this to the attention of the UN, that is the United Nations Framework Convention on Climate Change, to institutionalize the negotiations in relation to health and climate change so that they can be given due consideration. And I think moving forward in COP28, it will be very, very important to continuously push this and be able to see that health is given key attention, because at the end of it, when we talk about climate change, the end result is about the human and lives, isn't it? If you're talking about resilience in ecosystems, you want people to live in a better way, isn't it? When you talk about resilience in road infrastructure, you'd want people to live in a better way. When you talk about resilience in water, resilience in agriculture, the end result is that you would want to improve food security, and food security is about the quantity, but also the quality of the food that we eat. And in energy, name it, because at the end of it is about the lives of people to live with climate change and also address the causes of climate change in that direction. So I think that is really very important. Those that we're going to negotiate climate change come Dubai, starting this month and ending in around mid of what? December, is that we need to push for health. And to me, I would say that as we try to push for health as an agenda, we may need to take it as a cross-cutting issue, because you could realize that some of the intervention that we're pushing for, they are falling in other sectors. So we need to take it as a cross-cutting issue in that direction, but also importantly is that the ultimate goal is that how do we mobilize resources to implement our health agenda and climate change? How do we mobilize technology, development and transfer, but also how do we mobilize capacity building to ensure that both the human health and the infrastructure in the health system are resilient to climate change, and they are low carbon in terms of their development aspiration. So with that, I thank you very much for giving me this opportunity. I have made this on behalf of my boss, the Commission on Climate Change, and I wish everybody good deliberation within this symposium on climate change and health. Thank you very much.
Thank you, Mr. Semambo, for fully representing your boss. Mr. Semambo highlighted the key aspects in national planning on the health sector in terms of climate change. And I would want to also emphasize this. Health is not, as WHO defines it, as a physical, psychological, and social well-being of an individual, not merely an absence of a disease. So it's not usually only like physical diseases. Oh, I have this infection, I have this disease. But there's a lot. It's a cocktail of a lot of factors that define health, and that is what he was talking about. So he also talked about projections in temperature increase, which obviously affects our ecological health. as someone who is coming from the cattle corridor, there's a lot of resistance from the pesticides nowadays. And we are wondering why. But it's obvious that with the increase in temperature, some pests are favorable. The increasing temperature gives favorable environment for these pests, which increase their resistance towards the known pesticides, and obviously affecting the livelihoods of those who depend on the cattle and other livestock. So it's very important. But also one key issue is the health negotiations. Mr. Semambo can tell you I was always in our youth negotiation training, I was vocal on things to do with health. Where is our position as the health sector in our national position paper? And because health is not a thematic area yet, we can only talk about health in things like adaptation, mitigation, capacity building. But I believe that with engagements like this symposium, actors in the health and climate space will push for development of health in the UNFCCC processes as a thematic area, such that we can negotiate on what we want in the health thematic area in regards to climate change. And so I'll go to our next speaker, who is going to talk about health in our country's NDCs, the nationally determined contributions. And allow me to invite Cecilia Alonyo from the Ministry of Water and Environment to give us a presentation on that. You're most welcome, Cecilia.
Thank you very much, everyone who has attended this symposium for health and climate change, and all protocol observed. I would like to start off this presentation. Actually, I'm so very excited that Mr. Semambo Muhammad is around, because he's one of the experts in this, in coming up with Uganda's nationally determined contributions. Yes, I would like to. Okay, so the outline of my presentation is just very, very simple. I have the background for the NDC, and then I also have how the NDC's processes were, the planning processes. I also have the scope on the NDC, and then the projected CHC emission levels, and then also the Global Health Alliance and health in NDC, and then means of implementation. What you should know is that NDCs are just what countries have come up with to reduce on their emission levels. So Uganda submitted her NDC on the 12th of September in 2022 to UN, which is United Nations Framework Convention on Climate Change, as a fulfillment for Paris Agreement Article 4, which requires countries to come up with their emission reduction targets. What are your reduction targets for? And parties are supposed to come up with these in a period of 5 years. So it's a 5-year range of, yeah. So the first NDCs, the first initial NDC had a target of 22%, 22 emission reduction targets of 22, but right now the updated NDC of 2022 talks of 24.7% emission reduction targets. And what you should know is that these targets are brought about by mitigation and adaptation actions. And this will enable Uganda to fulfill some of the commitments stipulated under sustainable development, such as Sustainable Development Goal 13, also the Sengai Framework for Disaster Framework, and the NDC is also aligned with Uganda's Vision 40, and also aligned with the third development plan of, yes. So coming up with the NDC, it was informed by the policy by the documents that you see right there, such as the National Climate Act, the National Climate Policy of 2015. These are some of the documents that informed what should be in the NDCs of Uganda. Yes. During the process of development of the NDCs, you'll find that the NDC is sensitive to gender issues, both in adaptation and mitigation actions. What you should know that this is the outline of the updated NDC. It has national circumstances, it has adaptation components, it has mitigation components, and it also has means of implementation. But the country's priority was on adaptation, and where adaptation addresses vulnerability and also increasing resilience of sectors and, yeah, resilience levels of sectors, and also addressing loss and damage. Yes. So what you should know that Uganda, in 2005, the carbon metric ton of carbon dioxide equivalent was 53.2%, 53.4, but this has gradually increased to 90. And this shows you that there is an increase in human activities, sectors, different sectors like energy, we have industrial processes, and we have agriculture, we have waste. Some of these sectors are gradually increasing the levels of carbon dioxide that is in the atmosphere. And we see that greenhouse gas emission projections by 2030, we shall see that there's an increase up to 148 metric ton of carbon dioxide equivalent. And this is if nothing is done, that is BAU, which is business as usual. If nothing is done to come up with actions to eliminate greenhouse gas emissions, we shall see that there will be an increase to up to 235.7 metric ton of carbon dioxide equivalent. Yes. So we adaptation processes and planning. These are some of the events that took place during coming up with adaptation components. And why am I talking about adaptation? Because this is where health issues are mainly handled in. So And we see that there was a climate risk and vulnerability assessment that was done. I'm only going to mention health. Health, as you can see, a rating on health is 3.67. That's the vulnerability rating. And then we also have a risk rating on health, which is 3.33. Yeah, so we see that these climate change impacts are affecting health, infrastructure, food insecurity, water resources, and climate and energy and ecosystems. Yes, so the Global Climate and Health Alliance did an assessment on the healthy NDC scores of countries, and these were countries that submitted their NDCs from 1st October to 21st October, from 1st October to 23rd October. And the GCHA was looking at health, was looking at integrating health governance, was looking at when NDCs were being the process of developing the NDCs, what was done, was health impact looked at, was health sector consulted, are there some core benefits of health, are there some core benefits, and also what are the economic and financial implications. And the scores of all these categories were 8. And countries like, actually, Burundi had scored 17 out of all these in their NDCs. So I would like to say that Burundi is doing very well. But you see that Uganda actually scored 11 out of 18. So you see that in intergovernance, where the health sector was consulted, so Uganda scored 1, some of the impacts, Uganda scored 1 as well, and then health sector actions towards climate change, addressing climate change, Uganda scored 3, and some of the core benefits were 3, but we don't see any economic financing in health. So Uganda scored 0, and also monitoring and evaluation, Uganda had 3. So Uganda scored 11, but some of the countries like Burundi, just our neighbor right here, East Africa, scored 17. So in Uganda's NDC, we see that if health is integrated and health is looked at as some of the sector that climate change is really affecting, we shall have a sustainable and resilient health sector. And we also see that some of the core benefits will be in sectors like health, water resources, and waste. Climate financing, this is some of, Uganda requires about 28.1 billion to implement its NDC, both mitigation and adaptation actions. But unconditional means the amount of money that the government is supposed to come up with, and then conditional means these are money that is supposed to be, finances that is supposed to be mobilized. But all these are cross-cutting in areas of technology, areas of gender, development, and capacity building. Yes. So thank you for listening to me, but if you want to you can get a copy of Uganda's NDC online and also look at what has been done in the area of health. Thank you very much for listening to me. That was it from me. Thank you.
Thank you so much, Cecilia, and a very big round of applause to Cecilia for that wonderful presentation. The NDC is an important tool for us as a country because we signed under the Paris Agreement, and this is one of the mandatory thing that we have to do every period of 5 years. And I'm happy to see that we are scoring highly, more than some other countries, though I think there is a room for improvement. But my key takeaways would be on the means of implementation, climate financing. You saw that we need 28.1 billion US dollars to implement our NDC. And only, I think 4 billion US dollars are availed by the government of Uganda. So where's the rest? We have to mobilize. And this has to do with the government, but also the private sector and civil societies and everyone who is here. So when you go to these engagements, especially COP, the upcoming COP, please try to pitch these projects that you're doing in the health space that are connected to, of course, climate change. I would like to invite our next speaker, who is Didas Namanya from Ministry of Health, and he's going to talk about, he's going to recap on the Uganda's National Adaptation Plan of Action, focus on health. You're most welcome, Didas.
Good morning, everyone. I would like to take this opportunity to present the recap of the National Adaptation Programs of Action. I think a recap is intended to see where are we coming from, where are we, and where are we going in terms of climate change. I think in the wisdom of the organizers of this symposium, it was important for us to understand where are we coming from. So in that perspective, I will show some bit of history, what we did in the past, and project the health aspect of the NAPA. So could we go to the next slide? I have to do it here? All right. I was not oriented, so some IT person needs to come and orient me in this one. How does it work? I think we should go manual, the old way, tapping. All right, you could do it there, and so that is more efficient. So, ladies and gentlemen, my presentation will cover the background. It's actually working, maybe in different positions. All right. My presentation will cover, it will be very brief, it's about 18 slides. The background to the NAPA methodology, very important, because we are still doing studies, and it could be a lesson for us to understand how we can do it best. Key health-related findings, are they still relevant? You should understand that we did the NAPA in 2007. It's almost 20 years since we did it. So we are trying to examine, is it still relevant? And lessons from the NAPA process. So the NAPAs basically was based on the fact that the UNFCCC acknowledged that some countries are more vulnerable than others, especially the least developed countries, where Uganda falls. And island states that are in the oceans are more vulnerable because of the economies that we have, and therefore they were asked to develop reports that could quickly communicate their vulnerability to climate change. And that was in Marrakesh in COP7. We are now in COP28. So you can see the time when these least developed countries were asked to develop a report to communicate the immediate challenges they were facing as far as climate change was concerned. So the NAPAs was provide a quick channel of communicating urgent and immediate adaptation needs of LDCs to the conference of parties. I think they fell short of communicating, and so what? Because as you will be seeing in the end, many of the projects that were suggested by the NAPA were not funded, were not implemented. So it was lacking in terms of what was to be done after the communication. So that is the document. I think you can also access it online, and it has all the information that I'm going to summarize here, especially regarding to health. So the methodology, we have been talking about multi-sector approach. We have been talking about multidisciplinary approach. It was very comprehensive as far as those aspects are concerned. The overall lead was the Ministry of Water, Lands and Environment. At that time, those ministries were still together. For those of you who know the transitioning, Lands is now independent, but at that time it was still one ministry. Then we had the Project Steering Committee as the key top technical team, Project Management Unit, and then the NAPA team, and then task forces. I'll go a bit into the detail. So those were the members of the Project Steering Committee, representatives from all those ministries: agriculture, health, finance, tourism, Ministry of Water, Lands and Environment, Department of Disaster Preparedness, Office of the Prime Minister, education, local government, justice. We even had justice. I think climate change has got issues of justice, equity, NGOs. We had CSOs and NGOs. We had focal points of UNFCCC. I think that's the Ministry of Water and Environment. So this was the composition of the NAPA Project Steering Committee. Then we had the Project Management Unit and the NAPA teams. The Project Management Unit was made of 2 project managers and chairs of the task forces drawn from different disciplines. But disciplinarity was key in the NAPA process. Then we had the teams. This was a broad-based team composed of technical officers drawn from all those ministries that I've just mentioned. And they were in charge of implementing the activities. It was basically doing the assessment. We had 3 task forces: agriculture and water resources. We had health, and then forestry and wildlife. But you should note that all these teams tackled climate change regarding the highland ecosystem, the lowland ecosystem, the aquatic ecosystem, semi-arid ecosystems, and the Lake Victoria Basin. We wanted to cover the whole scope of the country, looking at those ecosystems. That is briefly the description or the distribution of the districts. At that time, the districts were still very few. I think there were around less than 100 districts. Much of those districts have now been cut into smaller pieces. But you can see we covered a broad aspect of the whole country looking at those ecosystems. The highland areas, mountainous, the lowlands, the cattle corridor, we try to cover all those regions. So what specific methods did we apply? We did literature review and second data sources, which were analyzed both online, published literature, and so on. We used surveys, focus group discussions were done, key informant interviews were done, but more specifically, we did participatory rural appraisal. I think those of you who went to university in the 90s and 80s, that was a very important methodology of doing rural research. It has transitioned into now the key informant interviews and things like focus group discussions, participatory methodologies, qualitative methodologies. We didn't do much of quantitative methodologies. It was more of qualitative methodologies and consultations. So we did ranking of interventions that were discussed in the district, regional, and national consultations, what we called at that time validation workshops at the district level, at regional level, and at national level. We held many consultative workshops because at that time, climate change was a new idea. We have now transitioned into, most people know about climate change, but in the early 2000s, it was still a new idea, a new phenomenon, so we had to raise awareness, discuss, and consult people about their ideas about climate change. I don't know whether you are able to see those, but what is important is that we found major disasters through the PRA or participatory appraisals, and droughts, floods, and all those disasters were registered. And these have very serious impacts on health, as the previous speakers have already mentioned. Then we had major impacts of malaria, of other factors, major impacts of disasters on the health sector that were picked from the PRA discussions. I will not read all those. Some of the speakers have mentioned about the impacts being direct and indirect. The direct impacts, of course, include like the diseases. They include the destruction of the infrastructure. They include the things we face directly. Flooding, when it happens, it washes away latrines and all those kinds of things. But indirectly, like mental health, the people who deal with the injuries, the injured people, the deaths, they are mentally affected. So climate change has both direct and indirect impacts on health. We find that as far as diseases are concerned, malaria, diarrheal diseases, direct injuries and deaths were some of the things that were discovered through these assessments of the NAPA. Among the diseases, we had malaria is key, cholera is still very pertinent because of the flooding and poor water resources that we have. Injuries, deaths, mental health, all those were discovered during this NAPA assessment. Now, during that time, we tried to find out how do the communities cope in terms of facing the climate change challenge. And we found that these are real, actual, on-the-ground responses, exploitation of aquatic resources, especially during drought, because when there is drought, things like fishing increase and looking for food in the wetlands. Food preservation, we found unique ways of preserving food for the future, especially when climate change impacts are anticipated, like putting meat in honey, in Kapchorwa, they preserve meat in honey for a long period of time. Use of herbal medicines, renting land, and using unconventional foodstuffs. All of us who are here, I think you know, during famine, we tend to resort to things which we didn't used to eat. The types of matoke, which are normally used for brewing our local blue. Instead, we turn to them and start eating them. Wild yams and such things that we didn't used to eat. So, in the cattle corridor, we had issues of water harvesting, the dams that were constructed at that time, soil conservation, using special plants, changes in husbandry practices, self-help initiatives, traditional vector control. For instance, in the cattle corridor, we found that people can use burning of cow dung to chase away mosquitoes in the households. This is a unique aspect and indigenous knowledge. We had issues of increased encroachment. Some people encroach on national parks, on wetlands in order to survive. Special practices of hygiene, hand washing, especially during flooding. And we also found out that there are district disaster management committees which were established in order to respond to climate change hazards. But these normally become active when the disasters actually happen. They are normally latent during the most of the time. Let's look at category B, coping strategies. Some of them are very interesting. Shifting cultivation, incursions in wetlands, again, migrations, people migrate to other areas, especially urban areas, especially males. Because they are unable to provide for the households, they tend to migrate to urban areas to run away from responsibility, I guess. Sale of assets, household assets, in order to survive, and start up stocks. You know, in our culture, we keep seeds for next planting season. So people eat these seeds when there is climate change stress. Encroachment on wetlands, exploitation of forests. Very interesting, we had famine marriages. This is very interesting because some families would marry off young girls to get dowry in order to survive. This was very serious, especially in the eastern part of the country. Hunting of wild birds and animals. And some people coped by just idling, going into the trading centers and idling. I don't know whether you're able to see this, but these are the final list of prioritized interventions that we picked in the NAPA assessment. The ones I've highlighted with a pointer are those related to health, water and sanitation, water resource use, and of course health. They are categorized in terms of urgency, immediacy, and coverage. So lastly, we look at the NAPA projects. the NAPA identified 9 projects that would be implemented in order to tackle the climate change challenge. But as I conclude, you can see that community water and sanitation project, it was a very well developed project. Vectors, pests, and disease control project, and then climate change project. The 3 of them were very relevant to the health sector. But as we go ahead, now the technology is misbehaving again.
Please make it work.
I would like to now conclude by looking at the lessons. What are the lessons of this NAPA? Is this still relevant for us today as we tackle the climate change, as we go to the Conference of Parties in Dubai? Is the NAPA still relevant? I think it is. It pioneered the countrywide assessment of climate change in the early 2000s. Throughout the participatory appraisals and consultative workshops, we were able to raise awareness, and I think by this time we are continuing to raise awareness. It documented climate change coping strategies, which are still relevant. We may need to analyze this further. It promoted public-private, public-public partnership, which is very key in tackling the climate change challenge, because it is a cross-cutting factor. The academia was involved, and it promoted transdisciplinary people from water, people from health, people from agriculture. We came together and worked together to have a report, to have recommendations. Most of the proposed NAPA projects have not been implemented. That's a big question. That's a big pointer. Where do we go? As we go to COP28, can we see that the reports, the ideas we have can be funded? Can we have homegrown sources of funding for our projects, climate change projects? More importantly, the NAPA methodology and approach can still be applied. As we do studies and assessments, we can apply the NAPA approach. With those remarks, I want to say thank you for listening. I look forward to any discussions and questions or comments. Thank you very much.
Thank you, Mr. Didas, for an exhaustive presentation on national adaptation programs of actions. And without wasting time, I would like to request Mr. Didas to share with us that presentation, such that any one of us who might want to have a look accesses it. I would, from there, I want to invite Mr. John Bosco Isunju straight away to tell us more on climate vulnerability and adaptation assessment, progress, and preliminary findings. Mr. John Bosco, you're highly welcome.
Okay, thank you very much, moderator. And my name is Dr. John Bosco Isunju. I work with Makerere University School of Public Health. I am the team lead on the assessment, VAA and HNAP, which is climate change vulnerability and adaptation assessment, which we are conducting nationally. to inform the development of a national health adaptation plan. Already, previous speakers have been talking about it. We are here to implement it, and we are being supported by Rockefeller Foundation that gave us a grant, but also we are using some methodologies from WHO and collaboratively working with the Ministry of Health. So just to quickly take you through the background, already various speakers have talked about the health outcomes, both direct and indirect, those that affect the infrastructure, and the direct health outcomes like the burden of disease. Of course, these result from the change in environmental determinants of disease, such as creating breeding sites, creating food insecurity, and affecting shelter issues. And these eventually precipitate the outcomes that we see. And we live in a region which is really infested or rich with all these disease organisms, disease-causing organisms. We call it viruses, the hosts, the vectors. So any slight change in environmental conditions actually triggers the proliferation and change in life cycles of the vectors and the hosts and migrations, etc., which leads to spread of the diseases. We have challenges of competing needs. We're a developing country, and these competing needs affect how we adapt, how we prepare, because we tend to come in to respond. And yet climate change is calling us to get prepared, to prepare so that we reduce risk. The health managers and health workers lack awareness on climate-related health issues. There is inadequate collaboration between the actors, the various stakeholders, difficulties in mitigating emergencies to climate change. And of course, the district level structures are ill-equipped to cope with climate-related challenges. So, over the different COPs, including COP27, Uganda committed to developing a national health adaptation plan, and prior to that, to conduct a VAA. So we have been working with the Ministry of Health, trying to look for funds here and there, and the WHO. And luckily, we got Rockefeller to commit to support us. And in this assessment and the plan, eventually, we are having 4 main objectives. One is to assess the climate change-related risks, both present and future, and then looking at different areas like the workforce, the infrastructure, the energy, water and sanitation. And then we look at the impacts, because when you look at in assessing risk, you look at the hazard, and then you look at the exposure, and then vulnerability, and then the capacity to adapt. If the capacity is not there, and you have the hazard, you have the exposure, then you're going to have an impact, or you will have a risk of an impact occurring. So we are assessing the current impact and the potential of future impact. What happened in Kilembe, for example, is an impact. It's not a risk. It really happened, and we saw the hospital being swept away. So that is an impact. And then we're looking at mitigation, adaptation, and response plans, or which would eventually inform the national adaptation plan. And we're also looking at mechanisms for ensuring that these adaptation processes are monitored, they're implemented, they're evaluated, and improvements are done over time. So findings, so far we have been to all the facilities that we targeted, 726, or around in 43 districts. And in terms of the levels, you can see majority were lower level facilities. The green showing health center 3s and the yellow showing health center 2s. And you know that these facilities, the lower level facilities, are scattered in rural areas, and most of these are within vulnerable areas. Some of them are up in the highlands, others are in low-lying areas but embedded in communities. Others are very difficult to access, so they are affected whenever it rains. Majority that we studied are government-owned. Now, we wanted to first filter to see which facilities or region or district is affected by what hazard. Because you need to first see, is this hazard there? You cannot go, for example, to Soroti and look for landslides. It is flat, so you need to first filter out. So that's what we first did, and what we saw is that majority of health facilities were really exposed to drought, highlighted in red there, nearly half, nearly 50%, 47%. And also nearly 40% were exposed to floods. So if we're talking of the major hazards that are affecting the health infrastructure or the health system, you're looking at droughts and floods, and then we have storms coming up at 31%, and then the water level rise. You remember Lake Victoria rose at some point, and then in Bulisa and those other low-lying areas, they have also experienced water level rise, and some facilities have been submerged. So this is slightly different from the flooding. The flooding may happen over a short time. Okay, so this is just a demonstration of what happened, an impact I just described in Kilembe. So this is what happened in Kilembe. The hospital was swept away. And when we were trying to categorize the impacts, we categorize them as major, moderate, or minor. So the description is given here for what we are calling a major impact, a minor impact, and others. So this is just to show you how our methodology is going to run so that you don't get confused as we go along. And then for vulnerability, we also categorized the vulnerability. For example, if we're looking at the component of health workforce, we want to see the extent to which this health workforce is vulnerable to a particular hazard. To what extent is the health workforce vulnerable to floods? And to what extent is the health workforce vulnerable to storms or heat or water level rise? So we, up in the columns, you see that we have the different hazards and risk levels. And on the left, we have the different components that we are assessing and the ones that were, and the levels of vulnerability we are looking out for. So you have things that could easily be affected by climate change hazards, such as water, sanitation, and hygiene, waste, healthcare, waste management. You know very well that if you don't have alternative sources of water during drought, what will happen? You'll not even be able to clean the health facility. And if you don't do good cleaning, you know what happens. Okay. So the results I'm presenting here, I beg indulgence, don't get confused. This is a vulnerability and adaptation assessment. The two are opposite of the other. If you have a good adaptation or good resilience systems, you will have low vulnerability, okay? So when you see flipping of these, the results here, it means the other side is showing vulnerability. This side is showing adaptation mechanisms. So let's say the health workforce, we're saying that the health workers participate in drought, water, and climate change adaptation plans and policies. If that is really happening, what would you expect? You'd expect them to be resilient because they participate in putting up plans and policies to protect themselves. Okay? That's what we want to come out in the plan. When we develop the plan, we want to be able our health workers to be able to participate in drought, water and climate change adaptation plans and policies, and all the rest as we go down. So the current situation is that we have high levels of vulnerability because they are not doing these things. So the levels of vulnerability are indicated there as red, and where they are doing something, they are falling in green. You will find low vulnerability. Okay? So what you're seeing there is the number of facilities or percentage of health facilities that do not have these resilience mechanisms in place. Okay? So here is the WASH and healthcare, water sanitation and hygiene, and healthcare in healthcare settings, and healthcare waste management, where we have some indicators such as healthcare facility has water management plan to identify water contamination, for example. We know that when it floods, water sources get contaminated. So our health facility is able to tell that their water sources are contaminated. If they are able to tell, then they are not vulnerable. But if they are not able to tell that their water source is contaminated, then they have high vulnerability. Our results show that you see that nearly 60%, this is 53, are vulnerable. They don't have any contingency plans for monitoring or reducing contamination. So meaning that whenever it rains or floods, the contamination go in the water sources and nobody gets to know, and they just continue to use the same water. When it comes to energy, we are trying to see, do they have do they regularly have an emergency backup generator to be able to cover them in times of crisis? And do they periodically check this emergency backup generator? Do they have it in a place that is protected from, for example, from flooding? These simple checks are the ones that we check down at the health facilities. Now, okay, thank you. So I just wanted to pause and say that while we are assessing vulnerability of the health system, because it is the health system that responds to the other outcomes of climate change. So if you said that climate change leads to increased malaria, so what? So you need to build a system that is going to address the other outcome. And that's why for us we are focusing on the system and trying to assess to what extent is our system robust. Okay, since now I've given you the whole structure of how we are doing the assessment and results, I'll just quickly scan through. So if we see the impacts, that was vulnerability. If we were to look at the impacts, the proportion of health facilities that are actually impacted by drought, you remember the first graph I showed up there. It is the different numbers are indicated here, and the components of the health facility actually affected. You look at the health workforce, look at WASH, look at energy, look at infrastructure and technologies, being able to relay data in time, etc. And how actually does drought, for example, affect the workforce? So the data is quite desegregated to see how each of the hazards affects a particular component of the health system, so that when we're planning, we're discrete enough to address the real issue. Okay, so just quickly to conclude here is that, okay, we found high levels of vulnerability. And this is because they are unprepared. In terms of energy, they are unprepared. They don't have backup power solutions. And where they are no systems to regularly check their safety. And then the health workforce don't really participate in climate change adaptation plans. And they also don't have any protective gear when they need to. And then when it comes to WASH and healthcare waste management, there are insufficient strategies for monitoring and reducing water contamination, limited preparedness to vector breeding, the facilities, hazards in waste storage, they are not adequately secure, and also the infrastructure systems have limited post-hazard recovery plans. Yeah. So part of the resilience plan is recovery. For example, Kilembe has experienced that. What does it take for it to come back to its feet? If it's not able to come back, meaning it means that it's not resilient, okay? It has high vulnerability. It cannot come back to how it was. Yeah, so that is what our stakeholders raised some recommendations, but we think we'll get a lot more when we do a stakeholder validation workshop of these findings next week on Tuesday. We will invite some of you to Rider for another workshop where we shall go through in detail and discuss the findings and use the findings to develop a national adaptation plan. So this is the roadmap. We look forward to further interaction. Thank you.
Thank you, Mr. John Bosco. Thank you very much. And because you called for an interaction, I know most of you, just like me, have so many questions that you have in mind from our previous presentations. So I would kindly request our previous speakers, that is Cecilia, Didas, and John Bosco, to kindly come on the panel, and we have a few questions from the audience. But in meantime, please, I know all of you are using social media, and I'm not seeing us trend online. And we are saying that the climate and health topic is so much sidelined. It shouldn't be sidelined even when we are engaging. And we are, in the digital era, so we have to, trend. Please make some posts about this symposium. Make us trend, because we want the health and climate change topic to trend, So please, Cecilia, Didas, and Mr. John Bosco, please, can you have a seat? And Doreen will help me move the microphone around. If any of you have questions or a question, please make use of those. Oh, okay. Yes. Yes, yes. So we are taking questions now. If you have any question from the NDC presentation, from the NAPA presentation, and the most recent one, you can fire it to our speakers, please.
Yeah, thank you so much. I am Charles Kaviswa from Regenerate Africa. And I like the conversation, and thank you so much, the tree adoption, for bringing different stakeholders to have this healthy conversation on the climate and healthy connection. I have two comments and then one question. The one comment to Cecilia, I think in the presentation we missed a stronger slide on the health adaptation priorities, which are included in the NDC. Because, you know, the health folks in here are more concerned to see that intersectionality of the health into the NDC. I think that was very, very important to have at least there's, I think, around 2 pages which are talking about health as an adaptation priorities within the NDCs. But I'm happy that the document is available online. Then also I had a feeling that because of that change in the revised NDC, the positioning in terms of the NDC scorecard is putting Uganda in a very far higher position, because what you referenced is a post of May 2022, and yet our posted updated NDCs were in September 2022. So when you look at the UNFCCC scorecard, Uganda and the Marshall Islands are put almost at #1. So we are doing it much better, and I want to encourage, of course, thank the government for doing that landmark. Then to leaders, I wanted to know now, because we are talking about the NAPA, which in my view they are all the NAPA. So where is that linkage? How are we transitioning? Of course, there is already evidence on the health impacted by climate, but then how are you informing, for instance, the ongoing process of John Bosco and the colleagues who are now transitioning into developing the health NAP? The last one is on the study which is going on. I am a bit worried because I see the focus is mainly on the workforce and the health facility. And again, when I look at some of the recommendations, of course this is preliminary data, there is again a siloed way. We are now moving away from siloing, being in a sector kind of mentality in our programming, including our research, to bring sectors together. And that's why the health sector hasn't been getting funding. There is barely no GCF funding to the health sector, probably, apart from one that has just been approved, I think a month ago. I can't get the statistics. So we are siloed as the health folks because we are not building a case, a business case on the impact of health and the climate. So I see this in the study because we cannot focus entirely on the health sector facilities and the workforce, minus now moving down into the women who can't access, for instance, maternal services, the sexual reproductive health facilities and services, family planning. So the access, the demand, because the roads are impassable, the nutrition that suffocate even the health indicators. So I think for me, we shouldn't focus. We need to extend a bit into, I think get some hotspots and get some data on the real communities that are being impacted on the health aspect, so that we can inform the NAP, health NAP. And this health NAP has to be intended to be intersection. We have countries like Tanzania, they have had it for 5 years and no single funding, and now they are revising it because they siloed it. So we have to benchmark it with some of those either failed or successful NAPs that are sectoral NAPs.
Thank you very much. But I would request that next questions we should at least have 1 or 2 from one person, because at the end of it all, we might have one person asking questions. So.
Okay, thank you so much. moderator. My name is Robert Tuyachira from the Environment Shield. For me, I'm not worried like my friend Kabiso, who is very worried. And I want to start from the issue of mental health. It is true that this discussion is timely, and personally I'm very excited about it. It's an area I'm paying a lot of interest in. And I want to ask the Minister of Health how we are equipping our mental health facilities to ensure that we accommodate the big number of people who are actually being ravaged by these climate-related disasters. Because we see, for example, when you look at across the country, River Kafu flooding, we've been seeing all these places which are affected by disasters. The people, their state of mental health has been so much affected. But we see still the mental health facilities, like for example, Butabika, is not being prioritized to actually handle some of those numbers. So how are we ensuring it will be mainstream? Because I was reading a report the other day which was run by Monitor that 30% of Ugandans actually have mental health challenges. Yes. And this is being worsened by climate-related disasters. So that is a question to the Ministry of Health. But the other bit also is how do we ensure, because this discussion needs, as you said, we need to really widen it, to broaden it, especially among young people. Because talking about mental health, young people are the biggest victims of mental health challenges. So when you look at the dichotomy between human health and veterinary health, there seems to be now that does no longer work. So we need to have a one health approach, because we saw with the rise now with the pandemics, I was trying to do some reading about the zoonotic diseases, where it is showing that because of the migratory pathogens and the vectors, for example, like what happened with COVID-19, that we are on a tenterhooks as a population, that anytime we may get another pandemic. So how are we preparing ourselves as a country, as a Minister of Health, to ensure that actually we prepare for the next pandemic and then give a one health approach? Because now with the migratory vectors, we can no longer say we are sticking to only human medicine. We must now have a one health approach where we can be able to strengthen the system and probably see how we can build capacity to cope with other pandemics. Thank you so much.
Thank you very much. I think your question is recorded. Please, Doreen, can you be gender sensitive? Huh? I have a question here. And I keep asking people, whenever we are in such engagements on health and other intersections, are you among the 14 million Ugandans who are in that report of Daily Monitor, or you are among the other people? Just a question.
Thank you very much. Good morning. My name is Comfort Hajra Mukasa. I work for Amref Health Africa in Uganda. Yes, my question may not go to Didakas per se or JB, but it's for all the three. So yes, we're taking through these processes, and Didakas rightly said some of the activities we wanted to do in the past were not done, and now we want to tap into local resources. How prepared are we to involve the private sector right now and not wait for us to finish our processes, then think about bringing them on board? And to add on to the previous speaker, Uganda is predominantly youth. So how do we involve them now? We're talking about social media, but how do we involve them now to get on board and drive this agenda in a language that they understand? So meaning digital solutions. So if you're thinking of maybe whatever we're going to do, modeling, all those things have to be palatable to the youth. And then not to just sound like a woman, but I'm a woman, so I'll say it. Women are the brand bearers of the impact of climate change. When Kalembe was swept away, trust you me, the women felt the impact more than the men. The men do feel the impact too. But then my concern is, why are we going to wait to finish all the processes that come with a plan? Then we remember, oh, so the women, we found all this, but how do we involve them right now? And then make sure that they're part of the things that we plan to do, as opposed for us planning for the youth, the women, and then throw it onto them and say, this is a beautiful plan, let's involve the youth, private sector, implement. Thank you.
Thank you, Hajra. And I'm taking one last question here. Please, here. Interesting.
Thank you very much. My name is Dr. Christine Navidio, and I represent Path Africa. And my colleague Derek, thank you very much, Derek, for smuggling me into this room. I'm so excited and proud to be Ugandan when I see this, because we don't need to be worried. That is where it starts. If we have this, then we are covered. I want to thank the organizers, and then just one question, because all the comments are actually answers. Tulimu answer mwe tuzanyedde, so we already have the plan. And I also want to thank Professor Batte, and the team that has been the organizers. A hand clap to them before the end of the meeting. My question goes to the only presentation I listened to, and for the rest I hope I'll get the PowerPoints, because I need to smuggle this into other countries in Africa. Right now we are writing a proposal that needs all this going into that. You talked about energy, and then you talked about backup of fuel, and I was like, climate change, fuel-backed energy systems, fuel? So I was a bit confused there. I was thinking you were going to say solar and that kind of thing, so that's my question.
Thank you very much. I'm taking, oh my God. The more I take, the more I get other. So please, can we have it at that? Yes. I'll start with Didas.
Yeah, thank you very much, moderator. There are several questions which have been presented, but the ones directed to me are quite a few. The first one was on linkages of the NAPA 2007, now almost 20 years. How is it linking the current processes like the VAA? First of all, it is literature. Academically, you have to, I think they have reviewed the methodologies, for instance, what we did. At that time it was PRA, but now he didn't have time to present, but we have a component of engaging the communities through the VHTs to find out what are the views of these people, how is climate change affecting the communities, how are they responding. We have that component of the VAA. So it will enrich us the views and how people are responding at community level. Then there was also a question on working in silos. I think we are not working in silos. Our methodology is going to have consultations with almost all the sectors, because health cuts across all sectors. As Muhammad mentioned, the road accidents, that is transport, affects health. Water affects health. So we are not working in silos. At the right time, the VAA process is going to engage with all the sectors, all the NGOs, all the CSOs will be involved. The youth, Hajra mentioned about the youth. We shall engage them. We want to get representatives of the youth, because Uganda is largely youth. We need to get their views. We have to get them on board. How do we engage them to improve their health? Reproductive health is very critical. A lot of pregnancies during COVID-19, a lot of young girls, school-going girls had early, even some were married, early pregnancies. It's a big shame that we could have a big population of our youth get early pregnancies and have no issues. So climate change is also adding to that problem. Mental health, somebody mentioned about mental health. It is indeed a big problem. It is not expanding at the rate we would want it, but an effort is taking place. all the regional referral hospitals, all the general hospitals in the country have a unit on mental health. But we all know about Butabika and the major hospitals. But and we have 17 regional referral hospitals in the country. They have a unit on mental health. So we need to be aware of this and use this service. It is not very advanced yet, but we are heading there. The last question was on women. Women, I think through the community interface of our study, we shall get the views how we can engage the women. Lastly, he mentioned about the hotspots. Our sampling touched on all the areas of the country. The highland areas, if you saw the number, 43 districts, the climate change prone disaster areas like Kigezi, like Kasese, like West Nile, like Elgon region, they were all part of the study. So we think all these will help us get rich information that can inform our HNAP, Health National Adaptation Plan, which we think should be implemented. We are going to the COP. Let's go there and support us in a multi-sectoral way so that we can get people to fund this work plan so that we can excel in the whole world. Thank you.
Thank you very much, Titus. I'll first have Mr. John Bosco because a lot of questions were coming to leaders and John Bosco.
Thank you very much, Presenter. Yes, thank you, Mohammed, for these questions. We are not working in silos. He has already clarified. We are going to have a stakeholder validation workshop, and even the people that we are picking this information it was really from a wide range of stakeholders. And we are, in this workshop, we will have a co-design to make sure that Hajara's Comfort's concern is addressed of how we are bringing the CSOs and the private sector on board. We want to engage you in the co-design of the plan. So you are really going to be hands-on to come up with this plan. And I think Dr. Christine talked about sustainable energy, that we are talking of backup generators. Now, this was an assessment of what is on ground. It's not the plan. So the plan will have to look, to really read and see what is right for climate change. We have to look at both the contribution of the health sector, how to cut it down, and how to be resilient to the effects. So on how to cut it down is going sustainable energy. We have already piloted a project with the WHO in 36 facilities here in Uganda, and I think 25 in Ghana. And this was really powerful because to provide solar energy to even the staff quarters. So, and they would only consume 5% of the capacity of that project, meaning that it was built for the future. Even if it moved from health center 3, 4 up to hospital, that energy would still power. So that's the kind of projects we want to lobby. And that's the reason why we want to take this to COP28. We don't want to just stop at assessment and do the plan. Someone talked about the risk of having it documented and then we can't implement it, like in Tanzania. For us, we wanted to start really with high power. And we have a special meeting in January that will engage high-level people. Ministry of Finance, climate financing, all the donors that we can reach. And that is why we are going to pitch it at COP, so that we get other actors involved in implementing not only the national plan, but also the disaggregated plans at facilities and districts. Okay, and I think those are all.
Okay.
Yeah.
Okay. Cecilia, any comment? Just in case you have any question.
Yes, there was an issue on health adaptation priorities from the gentleman over there, and maybe I would like to invite my principal climate change officer, Mr. Muhammad Semambo, to give more clarity on that issue. Yeah, your question was on adaptation priorities and how health can be.
Principal.
Thank you very much. Today I wanted to listen in more, not to sit your side, but I don't know if even I recall them. But the most important thing is that, thank you very much, Charles. We have around 4 major things in the NDC, and they are tilted on adaptation. One is about increasing surveillance on the health and climate change diseases. And I think this is really very important because the first principle. Number 2 was about mainstreaming climate change and health in the sectoral plans and budget and projects within the health sector. And it was very, very important. That's why the work is doing will get the mainstreaming. Number 3 is to develop an holistic plan, which is the HNAP we are talking about. And then number 4, I think was, if I recall, number 4 was about early warning systems. Number 4 is about the early warning systems. But of course, there are other cross-cutting issues like building capacity, awareness. So if I have a chance, I would also ask him, because I have something that we need to talk about what he has presented. Thank you very much.
Thank you, Principal Climate Change Officer. And I want to re-echo a few things on mental health because I'm so passionate about this topic, and the intersectionality between climate change and mental health is quite alarming. I mean, we have to also understand our population, Uganda's population. The young people are one of the most affected groups. And if we are designing these projects, we have to look at youth-friendly work plans, because we might plan so well, but going down to implementation, it is a challenge because we have not studied well our population. So we have to look at friendly practices in ways in which we can downscale our work plans and implementation. So with that, I want to invite you to our next session, which is, I think you can, next session, which is tea break, but we are going to have a working breakfast because we have a lot of activities, and we don't want to miss out because of time. So we are going to be calling tables to have breakfast, but in the time of breakfast, we're going to have young people, young health professionals who are going to expo, then we can rotate. Is it? Okay. So in the meantime, we shall use this time to, the DJ, please. Can you have some sound to move the breakfast and the poster presentation session? And please, I can see new faces here. I'm looking forward to networking with most of you. So I hope that all of you are looking forward to that session. So in the meantime, you can also use that to get to know each other and network. But please, DJ, do something. Yes? You have a question? Okay. Can we move the mic? My colleagues. Doreen? Doreen is not another microphone, please.
Good morning, everyone. My name is Paul Kato with Ugandans for Environment and Climate Change Action. I would like you to all give a round of applause to Dr. Bate and the team. Those of you who are not aware of tree adoption, they are doing a very good job with the youth. We actually participated with them at the National Tree Planting Day sometime back in, I think 2 months ago in Kajansi. And we had partners like Roofings Limited. They were planting, there's a target to plant millions of trees. And what's the importance of the trees? The trees are acting as carbon sinks to try and reduce the carbon that is circulating in the atmosphere. So what would be bothering me right now is we are seated in a hotel room, which is probably set at around 20-something, 5 or 6 degrees. No, 18. It's supposed to be set around 26, and maybe the windows should be open. And then we could have this hotel contributing to climate change action. So, Dr. Bate and the team, thank you very much for this. We are very ready to add our voices to this conversation. And for everyone attending, thank you for coming. This has been a long time coming. What we do as an organization, we engage with the youth as well. We have waste management workshops we take to schools, especially the junior schools, and also do surveys on waste management in schools. And I think these are the areas to begin with, because if you're moving around Kampala, it's very easy to see somebody drinking a bottle of soda and then throwing it out of the window of their car. And it's normal in Kampala. Nobody questions, everybody goes their own way. But we have to instill this in the young population, especially the kids in the early classes. We have to let them know the importance of waste management, the 3 principles of reuse, reduce, and recycle, so that even the sector of recycling can get more funding from government and other supporters. Thank you very much. Enjoy your breakfast, and let's make sure we keep less waste around. Thank you.
People doing poster presentation. Hello? Hello?
About our efforts as EACO towards developing a low carbon, climate adaptive and resilient health systems in Uganda. Yes, in the ongoing global pursuit of building climate adaptive and resilient health systems, the role of contextual data, digital platforms, climate health and equity, and climate data transparency and public perception and awareness cannot be overestimated. Within this context, EACO, Makerere University, emerges as a pioneering force in reshaping the landscape of environmental monitoring and health in Africa. I'll be sharing briefly about the comprehensive efforts we've taken to build climate adaptive systems. As EACO, Makerere University, we've developed low-cost air quality monitoring devices that can report in real time air quality data and air pollution data. And we all know the synergies between air pollution and climate change. We've developed these monitors and we've deployed them in different parts of Uganda and Africa in general. In that context, to ensure that this data is used to take action, we've developed digital tools that each one of you, the various stakeholders, can utilize to ensure that they can access this data. Yeah, we have a mobile app, an analytics platform, and an API platform that can be used to integrate climate data with health data. And yeah, in addition to these digital platforms, we've engaged in workshops, initiatives that are geared towards making the public aware of the health concerns of air pollution. And we've had several of these with government authorities, community members, and carried out campaigns with partners in the house inclusive, tree adoption, like what you see up there at the university, people planting trees, and we know the role that trees play in capturing carbon emissions. Yes, so for more information, I think I'll be brief. You can find us on our store to discuss in more details. But this holistic approach, we believe, will serve as a great milestone for us to move towards developing climate adaptive and resilient systems in Africa and Uganda specifically. Thank you. In case of any information, you will find us there at that booth.
So we chose those three districts, and then we went to secondary schools in those districts. So each district gave us about 4 secondary schools. And we mostly considered public schools. And majority were boarding schools. And we went for children between the age of 13 to 17 years. We used standardized questionnaires to mainly assess the mental health challenges. And also we considered, we assessed for their coping strategies during this period. And we also tried to see if there was a risk of substance abuse during this same period. So the data we collected, we are currently still analyzing, but we have some preliminary findings. And just to give a hint of what we found, we found that about 65% had mental health challenges during that period. That's after the COVID-19 lockdown. And that was based on the questionnaire that we used. We used the Beck's Youth Inventory, second edition. It assesses for about 5 parameters, which include anxiety, depression, and all that. So combining the responses that we had got, we found that about 65% of the 762 school-going children we had interviewed experienced some mental health challenges during this period. And then we also found that a high proportion of students, which was about, if I'm to remember well, it was about 40%, had a high risk of substance use disorder. And this was assessed using the CRAFT tool. Then for the coping strategies, we found that they used emotional strategies to cope up with the challenges that had been posed by the situation they had gone through. That's the combined effect of the natural disaster, and then also the COVID-19 lockdown measure. Then for the factors, we try to assess for the factors associated with the challenges, and we found that having a number of school-going children, which was more than 5, was protective against mental health challenges. But then when you have a lot of children, that's still more than 5, who are not in the school-going age, it was predictive of predictive of mental health challenges, which is also quite concerning. So from all that we found, in conclusion, we found that after the COVID-19 lockdown, that's during the phased easing of the COVID-19 lockdown, most of the school-going children had mental health challenges, and then majority used the emotional strategy as a coping mechanism. And the other conclusion we drew was that a significant proportion were at a risk of developing substance use disorder at a high risk. So from these preliminary results, we recommend that we could include or incorporate psychological mechanisms of trying to address the high prevalence of mental health challenges, especially in schools, to combat these, to address the high risk of substance use among these children, and then to address the high prevalence of mental health challenges. Just to acknowledge our funder, we got funding from the National Academy of Science and also the United States Agency for International Development, that's USAID, to conduct this study. And the views and opinions from the study are solely for the author, and the funder didn't participate in any part regarding the execution and then the analysis and also drawing the conclusion. Thank you.
Thank you very much, Andrew, for your presentation. At this moment, allow me to invite Her Excellency, the Ambassador of Ethiopia to Uganda. Forgive me, I would not pronounce well your name, so I would request that he, yeah. Thank you. Thank you. A big round of applause, please.
The environmentalist Robert Swan said, "The greatest threat to our planet is the belief that someone else will save it. There is no one else to save it. We must. We must work together to reduce our emissions while achieving economic growth." Without further continuing, let me introduce myself first. My name is Tsaganet Bezabu, the Ethiopian ambassador to Uganda, Burundi, Union of Comoros, Central Africa, and Seychelles. So I'm 5 at 1. The Honorable Member of Parliament, Honorable Dr. Herbert, the Commissioner of the Environmental Health Department at the Uganda's Ministry of Health, a representative of the WHO, Dr. Atwan Diana, the Permanent Secretary of Ministry of Health, Professor Dr. Charles Bate, Executive Director of Tree Adoption Uganda, development partners, all representatives and invited guests, ladies and gentlemen, all protocols observed, good morning, and in my own language, Tena Yistelኝ. This has been a great example of different entities working together. I am grateful to the organizers for giving us the opportunity to discuss and formulate plans for Uganda. As mentioned today, developing countries are the most susceptible to the impacts of climate change. Weak infrastructure make the LDCs more impacted by flooding and catastrophic weather events. Lack of flood preparedness and the absence of irrigation system results in famine and increased disease such as diarrhea and dysentery and the likes. Poor air quality leads to significant respiratory disease incidents. On our crucial point once, I would like to make this because gender inequality in LDCs, especially women, are the most vulnerable to the impacts of climate change. They are less likely to own land or have access to legal access and participate in politics, earning good salaries or have input to infrastructure and government decisions. Therefore, we must adopt a gender-sensitive policies when we are preparing a climate change mitigation solutions. Excellencies, ladies and gentlemen, I would like to congratulate the government of Republic of Uganda for taking several policy measures to address the consequences of climate change. This will further strengthen the effectiveness of implementing Uganda's National Adaptation Plan. In Ethiopia's case, I would like to share some examples from our National Adaptation Plan as a part of Ethiopia's Growth and Transformation Plan, which we call it GTP1 and GTP2. The Ethiopian government has launched the Green Legacy Initiative, which is rooted in the vision of building a green and climate resilient Ethiopia. The Green Legacy Initiative was launched in June 2019. The initiative is primarily to tackle deforestation, land degradation, and climate change by planting as many trees as possible throughout the country. With 25 billion trees planted in 2019, Ethiopia is well on the way to achieve its goal of planting 50 billion trees by the end of 2026. The other major initiative in climate mitigation is the Ethiopian Grand Renaissance Dam, which is the largest hydroelectric project in Africa. This will save 10.6 million tons of carbon dioxide emission annually from coal, gas, and the so-called. In addition, our Grand Renaissance Dam will help the power irrigation system. It's a safer cooking method and finance more robust infrastructures such as healthcare systems. Climate change cannot be left to others to solve. Climate change knows no borders. As a representative of Ethiopia, I see our country as a part of the global team that must work together and win together to secure future for our children and for the future generation. Finally, thanks for facilitating such a rich discussion among the leading stakeholders to the organizers of today's event. I firmly believe the discussions and position paper will strengthen Uganda's negotiation position in the upcoming COP28 UAE. Thank you so much. Amasagnalo.
Thank you so much, Her Excellency, first for your willingness to come and join us in this discussion, but also for actively participating, because hearing your speech, it was quite very deep in the messages we want to streamline and highlight in the climate and health conversation. At this moment, allow me to invite the representative of our chief guest, who is not present, the PS, Dr. Diana Atwine, the representative, Commissioner Herbert Nawasa, to come and deliver her speech.
Good morning, all. Can I do this? Let me begin by introducing myself, particularly to those that we are meeting for the first time. You've heard my name. I am not the PS. My name is Dr. Herbert Nawasa. I'm the Commissioner for Environmental Health at the Ministry of Health. And that's the department that is the focal point for climate health in the country and is helping to coordinate all the prayers in the climate health space. I want to observe the protocol, and forgive me that I joined late, so I might make a lot of mistakes in the protocol arrangement. But let me recognize Her Excellency, the Ambassador of Ethiopia, and congratulate you to be part of this climate health conversation. We don't take it for granted that we have the whole ambassador whose interest largely coincides with our interest in the climate health space. I know that the WHO representative has gone, but we want to recognize the UN agencies, many of them who have been part of our conversation to raise interventions in that area. So the UN agencies, which include the WHO, the UNDP, UNICEF, UNFP, and other high multilateral agencies. Let me also recognize our own government. I don't know whether we are largely represented here from the government space. Ministry of Health, do we have people from Ministry of Health? Okay, I know that I'm here, Didekas is here. Ministry of Water and Environment. Do we have somebody? Thank you so much. Minister of Finance, is anybody from Minister of Finance? They are the focal point actually for climate change in this country. Do we have anybody here? Is the mistake ours for not inviting them? So we need to find out, because that's actually our, more or less our designated agency for climate change. Let me also recognize our partners, development partners like Rockefeller Foundation. Do we have anybody from Rockefeller here in the house? Okay, they are part of us. Thank you so much. And they are doing, did I see the hand? Rockefeller? Okay. We thank you, Rockefeller, for accepting to partner with Uganda in climate change and health. Now, there's a list of other very important CSOs, which include the tree adaptation. Dr. Bate, I don't know whether you're here. We want to congratulate you for accepting to be part of the whole discussion, not only discussion, but really taking up the mantle on climate change. Allow me to congratulate our friend, Dr. Catherine Pathfinder. Can you wave? We have had a lot of discussions, and can I see the other team from Path? You know, usually mix Pathfinder and Path. Forgive me for that. I don't know why it is intended to have the two organizations which look like the same, but Path, your sisters, and you're not brothers. Okay. There is a male issue there. Amref, I see my sister there. Can you stand up? That is Hajira, and we are doing a lot of work with them. Yadnet, our friend, can you wave? Thank you so much. RHU, I think this is Reproductive Health Uganda. Do you have somebody from there? Okay, thank you so much. What is CTPH? Thank you so much. You will tell me what is it in full? Conservation through public health. Now, there are a number of others that are not particularly on my list here, but I want to put our hands together to thank you all, our partners, especially from the CSO fraternity, for accepting to, and of course the academia. Academia, how many are we from academia? Thank you, Dr. Bosco, and the group, and we are partnering with you in a number of interventions, particularly the HNAP. So thank you so much for accepting to be part of us. So all the invited guests, ladies and gentlemen, thank you so much for accepting to come in. Now, the conversation of climate change and health is not a new conversation, but it is something that I think has not really taken a very big space. We know that we have done a lot in terms of the general climate change. All the available interventions, particularly our current policy, our current programs and plans, do recognize the health as a very key sector. And all the impacts actually that the climate change interventions tries to address, many of those are related to ensuring health operation. And so coming here today to be able to tease out, particularly the conversation on climate change and health, is a very important discourse. And I think for the country and for the health sector, we are very happy to know that now, away from the bigger conversation of climate change, we are particularly cutting out our part, that part of climate change. We know that it is a big conversation that should have started a long time ago, and I think it is never late. We can now begin to discuss that. And so I convey warm greetings from the PS who are supposed to be here with you. She had a very impromptu travel, and I think she's either returning today or maybe will return tonight. Her heart is here. Actually, we just spoke on WhatsApp this morning, and she said, you go and convey the warm greetings. The minister, too, is highly interested in the issues of climate change and health. We have had a lot of conversations with many of you, development partners, and she has interested herself actually to come and travel for COP and participate in the COP negotiations for health. So the Ministry of Health, the health sector, all the development partners, I think now the space is ripe to have that very rigorous conversation on ensuring that we have a very good interventions for climate change and health. But why are we concerned? And I see that the PS's points have attempted to write a number of issues, but allow me to speak off cuff, because we are here to have a conversation, isn't it? And I know what she's talking about is what you have been discussing this morning. And this is what we've been discussing. So this morning, what did you say is a challenge? Why are we concerned about the focus on climate health? Okay? I think your guess is good as what? As mine. Why we are concerned is that we see a lot of changing environment. A lot of changing environment, a lot of climate change, the rising temperatures. We see evolving issues that actually are related to the burden of disease. And many of these diseases are either emerging or re-emerging. When you look at the recent outbreaks, for instance, the Ebola and the COVID even, all seem to be speaking to issues of climate change. When you look at those diseases, let me just pick out, for instance, malaria. We have been fighting malaria for the last 2 years. The upsurge of malaria seems not to be coming down, okay? It is not coming down, and I think management took a decision to escalate the upsurge to an epidemic. So currently now we have instituted an IMT, the Incident Management System, to address malaria, just like other epidemics. Why? Because it has become stubborn. Why do you think it is stubborn? Do you have a guess? It has become stubborn because of environmental issues. We have seen the rising temperatures. We have seen the characteristics and the nature of the breeding environment, the habitat, but also the larvae and also the parasite itself evolve in terms of mutation. And so the current and the previous interventions have not been able to effectively address malaria as a burden. For instance, we see that the population is doubling, the population of mosquitoes is doubling because of the climate change. We see the growth rate more or less doubling. We see the biting characteristics have changed. Previously, we would see the mosquito biting time, we were very certain about it. You know that you have to close your windows, you have to enter early, make the children enter early, so that you know that the time for mosquitoes has started. Currently, it is very difficult to predict the biting time. They will bite you any time. Even here, they will enter and bite you, okay? They can bite you when you're digging. They can bite you when you're grazing. They will bite you any time. Why? Because they have evolved because of environmental factors. And so what do you do when you're faced with such challenges? When you have the vectors evolving, trying to adopt new strategies, and yet us, the human beings, still stick to the old school of addressing such interventions? Is that the best way to be doing it? I think the best way to do it is to do what we are doing now, to put our heads together, to begin to deliberate about the new strategies to handle some of these challenges that are emerging as a result of climate change. So as the Ministry of Health, we have thought that we shall not sit back, and we have engaged all the stakeholders, including the Global Fund and all the funders, to be able to look at environmental interventions, such as larviciding, for instance. Larviciding by handling the larvae, because we know where the larvae resides, don't we? We know where the larvae resides, we know the breeding sites, so we cannot pretend that we shall continue to provide mosquito nets all the time and do other measures, but we need also to address environment. So when we sit here today, one of the strategies we will be looking at is how to address the burden of disease. And it's not only malaria. When you look at, for instance, wash-related diseases are as a result of climate change in part. When you look at the recent flooding, for instance, when you have a huge rain coming, the next is flooding, and the next is washing down of wash infrastructure. What is the most burdened? Our toilets. They are washed down. We have even seen health centers being washed down. Who gets most affected? The health sector and the people. So it is therefore important that much as we know that the climate is broad, But it is time now to begin to single out the effect of climate change on health. For instance, when I look at statistics here, between 2005 to 2019, we had an average of 412 health facilities being damaged or destroyed. And I think this continues to happen. Now, we are talking about investment in health sector without talking about how we can maintain or preserve those that are already there. So does that make sense? Obviously, it doesn't make sense. When you look at drought, for instance, when you look at drought, for instance, you may think that the burden is in agriculture and it is food. But there is a very direct correlation between food and health. For instance, when you have a nutrition problem, then directly you have a health problem. You have stunting children, you have a population that will not be productive, you impact on labor, and eventually you impact on other social determinants of health. When you look at WASH, for instance, the diarrheal diseases, you have seen a huge burden of under 5 mortality, okay? Children dying because of diarrheal diseases, and partly this is as a result of climate change. So the burden is huge, the burden is real, and so we cannot shy away from it. So we must begin to have a conversation about what we can do. And what we can do sometimes rotates about individual effort. We have talked about, for instance, the gap in financing. But the financing is available. It is available with us. When you look at all of you development partners, okay? Each one of you has a budget, isn't it? Don't you have budgets? Have you looked at your budgets? What are you doing to mainstream climate change? What portion of your budget is able to address climate change impacts? So one of the adoptive, innovative ways actually to raise financing is through integration and mainstreaming, so that once we put together our small resources, then we add up with a serious fund for climate change interventions in part. Okay, so we believe that once we put our heads together, we should be able to address impacts of climate change, particularly addressing the impacts to health. So as a ministry, we have been part of a bigger conversation to ensure that we really cut out particular tasks. And one of them has been to support the policy framework. I know that we have the climate change policy, we have even the Climate Change Act, we have the NAPA, we have the NDCs. All these are efforts that Ministry of Health and the entire health sector partners have been part of, and want us to now, instead of looking around developing new policies, developing new programs, which are already in place, what are those particular things that we can look at that we can very quickly and fast address the growing impact of climate change? So at this point, Ministry of Health, working with Rockefeller Foundation, have been able to start up a process of the HNAP, okay? HNAP and the vulnerability adaptation assessment. Reason being that the current profiling of climate change did not bring out the requirements that we need to take up to address climate change and health. And so we want to applaud you, Makerere University, Dr. Isunju and the team. I am sure you should be speaking to something, isn't it? And that is the direction that we are taking, to be able to take action using evidence-based approaches, okay? And I believe that once that is completed, the next thing would be to sit down and we see how, as a sector, we can associate ourselves with the findings and be able to take up the interventions further. So beyond that, we believe that the upcoming COP28, is an important opportunity for us. First of all, to showcase what we are doing as a country, but also I don't believe in so much international space when the local space is really, really minimal. And sometimes we fantasize this whole space that we are in the New York, UN water, we go there, we make these declarations. I am coming from, for instance, the conference on African Conference on Sanitation. We have made our declaration there. You come back and you keep this very good document. If it is in soft copy, it is in your computer. If it's a report, it is in shelf, it starts gathering some dust. The idea is that as a country, what are the small things and the small ways we can do to address our own challenges? And I think the only small things we can do can be done here, isn't it? They can be done here. So I would like us, as we live today and as we head to COP, we should determine our own declaration here in-house. Does that make the point? Or make sense? If it makes sense to you, please clap for it. So we make our own declaration that in our small ways, we put up our own interventions. And we are not small people, because many of you are very big organizations. Many of you are very multilateral. You're also international. So we can agree that in Uganda, this is our cut, okay? I see, for instance, Seed Global. Seed Global, we had a very useful conversation in New York. And I think the entire leadership is agreeing to take the climate change path. I'm not going to mention each one of you. You know yourselves, okay? I know Living Good is my sister there. I know each one of you, just in one way or another. And I think if we agree that we divide our attention from what we are currently doing into climate change and health, we should be able to do a lot. So I want to invite you to join the Ministry of Health to be able to see what we can do as a sector, okay? And I know that there's a lot that we can do. So drawing the commitments from COP26, I think as a country we have led, but we are almost there. At least we are knocking off the agenda on the HNAP and the VA. We believe that with the development of the position paper, Dr. Bate, I've looked at the draft. Again, this meeting should agree on this position paper. It should not be an international position paper. It should be our own heart, our own position paper that speaks to reality, the real things that we think we can do here as a country. And let's not look at rocket science. Let us look at simple, doable things that we can do with available finance, and we should be able to move a big mileage. I don't want to turn this into a big speech. I know that we are gathered here in part to discuss the preparation for the upcoming COP, but like I said, we should be looking at things that not only for COP28, but things that we can practically do as a country moving forward, but also determining that we create a framework for continuous conversation on this subject. That once COP is gone, done and dusted, we are not going to go home and wait until another round of COP to begin preparing other meetings. It's going to be a challenge. So can we agree on a course of action? Can we put our heads together? Tree adaptation, today you worked with us to arrange this meeting, but all these people have potential to arrange different meetings. And my brother Yadnit, I think you have been knocking on our door many times. You have very, very big ambitions for climate change and health. So can we really get this conversation into real working mode, not working towards just international meetings, and then thereafter we forget. So with all those few words, allow me to declare this meeting officially opened, and you allow me again to leave a bit after some time so that I can go and attend to another meeting, since we are also very thin on the ground. Thank you so much for listening to me.
Thank you so much, Commissioner Herbert, Dr. Herbert. And he emphasized so much on scaling up local knowledge. And that's what we've been talking about since morning, local adaptation. We have had a few colleagues in the health sector coming up with innovations in the medicines, and they are not, well, we'd say, very much supported to scale up those ideas. So we hope that from today onwards, we can start supporting local knowledge. And for me, it excites me that our minister is interested in the climate conversation and is joining us to go to COP28, because one of the greatest hurdles of climate action has been political will. But it can be evidenced today that we are having over, I don't know how many ministries from the government. So we are very excited that we already have that political will, and we are hands-on people that are driving change. So I would want to call upon the first speakers You're going to have a photo moment with Her Excellency and the Commissioner, and then after that, we shall proceed with other program. So please, the first speakers, can you come in front, joined by Her Excellency and our chief guest. Yes. But I also want to recognize our online participants. Thank you very much for joining in. Please, you can make use of the chat box in the Zoom meeting room. Please. Cecilia, please. If you, okay. Okay. Our online participants, please, you can make use of the chat, Zoom chat, and also on our YouTube, please make use of the comment section. Your comments will be read here. If you have any question or even any comments, please make use of those platforms. Okay, I think we are done with the photo moment, and thereafter we are going to our next item, and this is going to be very engaging. As our doctor has been mentioning, after here we should have our position paper, and this knowledge should be from within us, not a copy and paste from these international documents. So please, we are going to arrange ourselves in groups, and we're going to have a discussion which will formulate our position paper, health stakeholder position paper in regards to climate change in Uganda. So right now, I would invite my colleagues to help me organize. Okay. Raymond, you're taking on this role, please. Raymond is going to take us through what is going to be done in that section.
Yeah, thank you very much. Good morning. Good morning, colleagues. Afternoon, yeah. I'm Raymond Ryoka. I am a team leader for AdNet Uganda. We are honored to be part of this agenda to advance the advocacy to make our health sector climate resilient. Notably, we thank the Minister of Health, Dr. Herbert, and your team for not relenting our efforts, knocking on the door, that learning from other countries, Uganda has to do something. Personally, I started engagement in the climate space in Marrakech at COP7, where I saw this declaration done, as Didas mentioned. So all of these years I was saying, what's happening for Uganda? When you go out there, countries are giving us a lot of efforts they're doing on climate change in the health sector. And I'm happy the steps being done under the VAA and the HNAP. And as stakeholders, we're there to support you and work with the Minister of Environment and Water and the other stakeholders. I'm here to, as mentioned, we ought, as partners and the government, to come up with our own position paper as a country on how we shall have our health sector climate resilient. And therefore, it is imperative that we give efforts on that element of ensuring that our health sector doesn't befall the impact of seen from the climate change. I'm here to guide on what you're doing We are arranging this position paper in a number of thematic areas. Number one, as mentioned earlier, we are looking at mitigation. We shall look at adaptation. We shall look at finance. And I agree with you, Dr. Nabasa, that we ought to have Minister of Finance in this room because it's a principle in this agenda, financing for climate resilience of the health sector. We know that last year, while in Egypt, heads of state approved the loss and damage fund. Where is the health sector in the L&D fund? In that we make our financing for health in the climate resilience effective. The other area is food and agriculture, and the last one is about just transition. These are the 5 areas we'll look at, but you have 5 questions which we ought to give to you on your table, and we request you to respond to them as a team. Then we get these ideas as a team, we are put together, we incorporate these ideas in the position paper, which will be shared with you for review and the country on. I request the project the questions on the screen. There are 5 of them. I can read them here, but I wanted them projected here for everyone to see. These 5 questions will be the center for our discussion to come up with our own position paper. The question number 1, what are the key climate risks for the health sector? Emanating from the discussions we have had this morning, what are those climate risks? And this is very important, ensuring that we're having the VAA and the agenda for health NAP development. Number 2, the second one. Oh, sorry.
Please, it should work, eh?
It must work, eh? Is it? The second one, maybe you can project it there. So that's our number 1 question. What are the key climate risks for the health sector? Then the second one, what mitigation actions can the health sector undertake to reduce climate vulnerability? I request we project it there because it's there, thank you. What mitigation actions can the health sector undertake to reduce climate vulnerability? The third question, what adaptation actions can the health sector undertake to achieve climate resilience? This is our third question. We ought to give ideas on to help us come up with the position paper. Number 4. You're too fast. Number 4.
Please go back to
Oh, number 3. Go back to number 3. Sorry, it's being faster. Eh? Yes. Now I said you're attentive. Eh? Thank you very much. Number 3. What adaptation actions can the health sector undertake to achieve climate resilience? Are we done? And number 4. What are the key policy interventions needed to support the health system adaptation and community climate resilience? What are the key policy interventions needed to support the health system adaptation and community climate resilience? That is number 4. Then the last one, number 5. What recommendations or priorities should the health sector focus on during the climate change negotiations at COP28 in Dubai? Our commissioner mentioned about what is very important for us to talk about health resilience in the climate negotiations. So what are those combination priorities? The last 7 COPs I've attended, this is the first COP that Uganda is going to have a pavilion. Let's clap for the country of Uganda. Let's clap. The last years, colleagues, you know, we have been running around different countries looking for space in their pavilions. And then we feel embarrassed at the country. So this is a plus for us. And there are a number of sessions that will be at the pavilion, and we believe these engagements will be there. So what is the assignment? On your table, we request you come up with the secretary. On your table where you're seated, you come up with the secretary, and then identify on these 5 areas we talked about, questions, give us areas of focus that you think are very important. And then the secretary will give them to us, and then we present it for intervention of the members. Are we together? So request that we get this done within 10-15 minutes, and that you can help us get this information.
There are actually 5 questions, and we are giving 5 minutes per question. So we're going to be flashing the question, and you discuss, then we go to the next one. But we're also encouraging the online participants to use the chat box to give your comments on these questions, okay? Yes.
Yeah, thank you very much. We are going to start with question number 1. Want to flash? It's not coming on. At your table, Your Excellency, our Ambassador, we thank you very much for sparing this time with us. We believe as stakeholders, you're going to work with you. There's a lot of learning from Ethiopia, the country, especially in these negotiations on how to make our health sector climate resilient. Thank you very much, and thank you for the support. Thank you. Colleagues, we have 5 minutes per question. Let me flash this. I'm trying to flash question number 1. Could we, the IT team, flash question 1? Our colleagues online, can they use the chat room to share your ideas, and then your, in relation to the questions. Let's flash question 1. Could we have question 1 up? Our IT? On each table, JB, don't worry, the teams are coming back. After JB, let's get these ideas, okay? Thank you. That's question 1. We shall flash it for only 5 minutes, and then we believe you by then you've gotten some ideas from discussion. 5 minutes, we look at this. The same way with the teams online. Can they share your ideas in relation to this question?
Hello? The countdown is on. I want to see you engaged, eh?
make them. That one.
3 minutes gone. Next question, please. Uh-huh. 5 minutes countdown starts now. Four minutes. Next question. Next question, please. And the countdown starts. Next question, please. Next question is over there. Last question. Last question, please. Come on, guys. Last question? Huh? Please, last question. Media tulifena. Secretaries should have good handwritings, that is. Please, the choice of the secretary should have been one with the better handwriting. Because we don't want to call you. You come and explain to us what did you mean by this. Okay?
I think it is time. The secretaries. Yeah, I know, yes. We are coming on the table to pick those ideas you have put down And we look forward to sharing with you during the meeting to give you ideas. So thank you very much for this cooperation. We are going to share with you the draft out of this, and then we will give input before it is made a national position. Thank you very much for your attention.
IT team, are we ready? Sorry? Moment. They should. IT? As we wait for the IT to be ready with the professor's presentation, please can I have your attention? The discussion is now done. Please. I would want to know whether we have, and I think Dr. Charles, do we have some online engagements, like from online? Okay, so allow me invite Professor John Kadu to take us through mainstreaming health into climate negotiations. And please, I'm calling you for the last time. Can I get your attention, please? So, Professor Kadu, please, you can have.
Thank you for inviting me. Dr. Bate, what is Dr. Bate? How much time do I have, please? How many? 10 minutes. Yeah, okay. That's a different. It's not that. It's not? No, it's not. That, it's not that. That's it.
Is this what you sent to Dr. Bate?
Can you check, please? You could pick it on your flash. Do you have a flash? I can give, huh? Yes, I have.
It has.
No, I see. Can you pick it yourself?
So, meanwhile, as we wait for professors, presentation, we want to give each table 1.5 minutes to present what they have been putting together. So, I'll start with this one. Is not ready, I'll go here. They are not ready as well. Here. Who is ready? Okay. There are some doctor friends of mine, so I'll start with.
Thank you. Question 1. One of the risks highlighted is emerging and re-emerging disease resistance, e.g. malaria and other antimicrobial resistance, increased pressure on the economy, for example, resources meant, for example, for infrastructure development deployed into the health sector, rapid population growth, increasing pressure on natural resources, poor waste management. Then question 2, capacity building of different stakeholders on climate change. Then another one is strict implementation and enforcement of the laws, because we have so many laws. Green mobility, here we're talking about non-motorized transport systems, e.g. walking, cycling, etc. Prioritized climate change financing. Responses to question 3 are similar to the ones in question 2, so they will refer to that. Then question 4, strict enforcement of the laws, policies, and frameworks. We don't really need to develop new things, because in Uganda, they say we have what we call paper tigers. The paper tigers that we have so many that are on the shelves that we don't refer to. Maybe then another one is prioritizing climate change initiatives. For example, creativity, innovations towards climate change. For example, we have surveillance systems.
Sorry to interrupt. We are giving our feedback in, just highlights.
Okay.
Not explaining.
Okay. Question 5, prioritizing resource allocation to climate change, research, creativity, and innovation. Then finally, investment in surveillance, early warning systems. Then finally, engagement of the most
next
groups of people, vulnerable groups of people.
Next table, please. You can do 2 questions, only 2.
1, infrastructure damage to infrastructure at hospital, pollution, increasing nosocomial zoonotic infections, emerging, re-emerging infections, food insecurity, and poor waste disposal. 2, capacity building for both community and healthcare facility workers, development and dissemination of early warning systems, increase and strengthening of disease surveillance, planning and budgeting for predictable and patient funding. 3, adapting climate smart waste mechanisms, mainstreaming climate change and health in other sectors, promotion of climate sensitive technology, meaningful involvement of all stakeholders, adaptation of sustainable multi-sectoral collaboration that would result in sustainable agriculture. 5, collaboration between all stakeholders, capacity building still emerges, implementation of existing policies, and review of all existing policy framework to come up with a streamlined guidelines. 5, increased
increased finance availability to health climate, dissemination of information and policies, operationalization of the NDCs, developing indicators, strengthening collaborations, gender-sensitive approach, accountability and transparency.
Another table, please. This side, yeah?
Emerging and re-emerging diseases, increased risks like flooding, which has reduced full attainment of social services, drought in relation to food security, destruction of the health infrastructures, pollution and respiratory issues, policy formulation and implementation being deterred by climate change, population displacement leading to increased pressures on health sectors in particular areas, mitigation actions, need for proper waste management of healthcare wastes, public planning of trees near health centers, capacity building, technology transfer and development.
Thank you. So the next table will do.
I'm happy that you're putting in we shall give you the contact to send that information.
Okay. So
yes.
please allow me to resume the program with our professor, and then after we shall do other tables. Please. Display that presentation, please.
Yeah, thank you. First, I should thank the team for inviting me to come and share our experience with the Ministry of Health. A few people here know me, and I know a few people. I am a retired professor of zoology at Makerere University, and I lead the climate change negotiations and the UNCCC for the government adaptations thematic group. I also am a team lead on a number of climate change related projects. We have a project on NDC action, which is taking place in 10 countries: Argentina, Vietnam, Bangladesh. In Uganda, we have 3 countries. I mean, Africa, we've got 3 countries: Uganda, Ghana, and Morocco. And this project is important in that it focuses on pulling funding to enable the countries to undertake or to implement the strategies and the projects, and name it, that are listed in the national NDCs, the National Determined Contribution. I've been taking part in the climate change negotiations for the last 15 years. So I'm a part and parcel. I'm the second generation of those who shaped the convention. Most of those that shaped the convention, we have only one person in this country, Mr. Philip Gwage, or the late Minister Kezimbila. And many of those are gone globally. But we are privileged to have Philip Gwage here. And that was the first generation who shaped, who negotiated the convention that we are talking about now. I am the second generation. In other words, I was trained by the first generation. So we've been following the conversation on climate change. For Uganda, the early days, we had the NAPA, and I'm pleased to see Didas, Namanya, iko wapi? Where's Didas? Mr. Namanya, where is he? Yes, that's right. That's right. Now, yeah, shake hands, sorry. Can we, Mike?
Can take a picture of the store post of Napa.
My age category is different, still skeptical about that. Okay. Thank you very much. So with Didas, we traverse this country. We divide the country into 5 ecosystems. We go the highland ecosystem, the high Elgon, Rwenzori, and the impacts there, the risks are different. And of course, people were not used to malaria, to get malaria there. We go to the lowland ecosystem, Soroti, Kasese, and the climate issue there. Sort of different. When you have floods, you need flood-proof huts in terms of adaptation. Then we have the aquatic ecosystem, the island, Bukakata, the Buvuma, the issue there, the rain, water-related diseases, the bilharzia. For other countries where there is sandy flies, leishmaniasis, trypanosomiasis, and all this. Then the Lake Victoria Basin as an ecosystem, typically with the rainforest, and you get malaria again there. And then we have lastly the fifth ecosystem, the cattle corridor, diagonal across the country from Ntungamo across to Karamoja. The problem here, the risks are related to temperature rise, the droughts, which impacts the crops and so on, that impact the health aspect in terms of nutrition. So we told the stories in the Napa, and then from then, the gospel, as it were, started spreading. And I feel impressed and encouraged when I see that people can talk about climate change. Previously, it's only a handful, they're not there. So you may think we haven't done very well, but we've done well. We're spreading. Sorry to go for the beaten track, but I thought you need a bridge to the past in order to leap into the future. Those who don't know the history, you need a history to move successfully in the future. So the health, the focus of this conversation is mainly about getting the health aspects incorporated or integrated or embroidered, taken into the climate change negotiation. And I shall impress to that it is a party-driven, so we need to operate within the party, the parties to the convention, the countries that signed the convention. This thing doesn't move somehow. Yeah, okay. I shall not go through all those because there are many. But the UNCCC, the United Nations Framework Convention on Climate Change, its objectives, we need to know the objectives of the convention, because once you know the objectives linked to mitigation adaptation, then there are threads, as it were, on which you can hang, you can grab when you're putting a case to take health aspect in the negotiations. Then the parties to the convention. Who are the parties of the convention? The parties are those people who signed the convention. Then you have the negotiating blocks. We operate in groups. There's the African group, the least developed countries group. We've got the BRICS, and so on. So In the negotiations, you come to decisions through groups, the EU as a group, and nothing is agreed until everybody agrees. That's an interesting circumstance because Burundi will hold the US, and the US will beg Burundi to agree to move forward. Otherwise, you'll be a deadlock. Then the commitments of parties under the Climate Change Convention, Article 4 of the Convention, the commitments, different categories of countries have different commitments. Then we need to appreciate this, because if you're going to talk about health and climate change, we need to know whom are you talking about too. The Conference of the Party, Article 7 of the Convention, yes, it has to take a regular cross-check on whether we are meeting obligation. So that's a regular. The climate change negotiations, the process. How do you enter the negotiating room? Who goes in there? Who doesn't? And who authorizes you to go? For anybody here who is going to go to Dubai in COP28, and if you're going to use a Uganda passport, you must have been accredited through the national focal point. That's the Minister of Water and Environment, currently Madame Mwebesa. And every country has a focal point. That's one person. Even a minister going to the COP, because the name has to enter the UNCCC security tags, and only the focal point that has a key, electronic key to register people. And we need to recognize that. Who participates is time, yes? Yes. Who participates in the negotiations? The bodies of the COP, the agenda items under the COP. I checked through the agenda items under the COP, the SBI, the Sub-Star, the CMA, SMP. These are bodies of the COP, and each has an agenda items, a list of agenda items. I was looking for health in each of those. I didn't see health, other agenda items. So the items to be negotiated need to be in the list. Mainstreaming issues into the negotiations. That's the focus of the thing. But you need these other peripheries before you go to benchmarking from past and ongoing experiences of loss and damage. We need to benchmark. If you're going to take health into the negotiations, as a negotiating element, we will benefit by benchmarking. How did we get loss and damage into the negotiation? How many years it has taken? Loss and damage took 30 years, 31 years to get a decision on climate finance, which we struck in the Sharm el-Sheikh in Egypt last year. And everybody's excited about that, but it's not coming tomorrow. You have to have the institutional arrangements, the modalities of application for that. Benchmarking from NAPA, we moved, I did ask the members, we moved from NAPA to NAPS. And there's a hurdle on that, moving from the short-term NAPA to the longer-term NAPS. The hurdle, which negotiating groups goes into that. The NAPA were for LODCs, for least developed countries. So it was not for Kenya, it was for Uganda, Burundi, Tanzania, the least developed countries, not Kenya. So how do you convince Kenya to beat drums about moving from NAPA to NAPS, which is for everybody? And the hurdle there, I'm bringing this because it is a hurdle to get health into the negotiating table. It has been a hurdle to get agriculture to the negotiating table. It's taken 10 years. So one needs to appreciate where the hurdles can be and how to overcome. Agroecology now is they're trying to get the agriculture people are trying to get agroecology into the negotiation room. It hasn't taken. 2 years ago in Ethiopia, training people on how to push it inside. But you have to convince other countries to accept that. It's a hurdle to accept, to convince other countries. The G7 and China, you got the EU, you got the US, you've convinced them. Otherwise, you have no decision. Human, I said, health. Is it human health, health per se, or ecosystem health, animal health, name it, plant health? So we need to identify what is it that we want. Because if you're going to look for funds, you're going to enter the health, human health, then we need to be precise on what you want. Then I have a way forward in that. Where do I start? I could start somewhere where let's move. That map is the little islands. You may not be able to read, but you see South America and North America. There are many islands in there, the small island developing states. Those that can be allies to us if you're putting a case on that. Commitments of parties, climate change negotiation. The agenda items for adaptation, in this case, I want to go now. I saw that somebody talked about loss and damage. That picture, the top one was taken, that's the Ruwenzori Mountains. These are dear to us. It shows glacial retreat, melting of ice. In our case, the first top one where there are two people was taken in 1906. 1906. And you can hardly see any peaks. And then the one on the left was taken 1958. And the snow is melting, you're starting to see the rocks. And the bottom right is I forget the name, but years after, 1972 years. So gradually, the snow is going, and the original size was about 7 square miles, not kilometers. Today we are left with the far less than that. And the impact that has, as the water goes down. We almost had an exchange of hot things between Uganda and Congo because one of the impacts of the snow melting, increase in water running down, was the change in the geographical border. Because along River Semiliki, the border between Congo and Uganda, set by the British, was along the river. So when you get denudation, remember geography, and then you find one home is in the Congo after years, and then war. Almost all the exchange of fires in that, about the border. That's climate change impact. We're taking some examples. Milestones, loss and damage is taken many, many years. Yes, 1991, the small island developing states, the seeds called for a mechanism by which they could be compensated for climate-induced losses. 1991. So from then until last year, negotiations have been taking place. No, sorry, should be going back. So then this structure shows some of the milestones winding up and down until 2007 last year. And health may not be an exception to these. Milestones, yes, that's one. We had Coronivia joint work on agriculture, just to set our mind that it's going to be not a short but longer journey to get health into the negotiating table. for agriculture, it took long because the developed countries looked at agriculture as a mitigation issue, thinking about cows, the European cows that are better digesters compared to our cows. I can see the body language in some of the people in front of me say, that's what. And then think about plants that are more absorbers of carbon, so you get germplasm from that. That's the focus the developed countries had. But the developing countries, the least developed countries, Uganda, Burundi, they were thinking, considering agriculture from the negotiation point of view as a food security issue. We think about Karamoja, there is a shortage of food, Ethiopia and all that. So the focus, so that divergent view was sticky for 10 years until a few years ago when you had the Coronavia Joint Work Program. The decision was achieved. Mainstreaming, yes, NAPs, moving from NAPA to NAP to NAPs, the transition was a difficult one, COP16 in Mexico. The way we get around that, we got around it. Bangladesh and Uganda, we sat at 4 a.m. and we say, let's have two decisions. One for the least developed countries to move on, because the NAPA was a short term to communicate the problems. But after the short term NAPA, you need to go to a longer term national adaptation plan, the NAP. But in the negotiation, you go to G77 and China, you go to the African group, you go to the LODCs. If the NAPA was for LODCs, you have to convince the non-LODCs to accept that move. So we say we have two paragraphs out of one decision, one to support the LODCs, to move on from NAPA to NAP, and the other for the non-LODCs. So that art of negotiations did it. So we got a decision, and that's how we're able to move. Health has to. We're getting there. They need to anchor. We need to anchor health in the negotiation, but how? The negotiation of various issues is a party-driven process. We need to recognize that. Nothing is agreed until everybody agrees. So if you go to Dubai and say, we want to get a decision on health, we shall not get it until we convince other countries. And it will not be done even in 2 years. It takes time. New issues are coming on board, how to be owned by a party or a group of parties, then by respective negotiating blocks. EU has to own it and say, yes, we accept that. America has to own it. Kenya has to own it. The BRICS. The BRICS, Brazil, India, South Africa, China, and Russia. Identify and articulate the key needs. You need to identify exactly what you need. Is it mitigation-related aspect, adaptation of both, or co-benefits? Yes, you need to identify the entry points. What will be the entry point of getting healthy? Identify potential for mitigation aspect. Identify potential for adaptation and co-benefits. Now, there's an increasing need for evidence in the negotiations room. A company that produces Mercedes-Benz in Germany will say the developed countries should fund the problems in Bududa. The Mercedes-Benz company said, can you prove that our action, production of Mercedes-Benz contributed the landslides in Bududa? Do you have evidence for that? Then we shall be bound by that. So there's an increasing need, and I was pleased to see that there were a lot of a presentation about research and so on. That's a good way forward. The strings to grab on. I call that the strings to grab on. If the boat splits open on the water, you will hold on a straw, I think it will save you. So we need strings to hold on. What are the strings that we can Grabble, the IPCC, the R5, the assessment report, the 6th assessment report, it does mention health. So that's something to grab on. The percentage of NDCs that include health, etc. You do some work on all the NDCs in the least developed countries and say which of those include health and what targets and indicators they have. Uganda's NDC is a wonderful NDC because it has targets, sectoral targets, mitigation targets, and adaptation targets. In that case, you're building a case for health to enter the negotiating room. The new score of vulnerability and risk assessment of health sectors in the Uganda's NDC, there are scores for vulnerability and risks, and I think it is 3.6. The maximum was 5, because these are information data you need to be able to mold something. Other avenues, response calls, you need to respond to calls for submissions on issues. And submission, you also need generate non-paper. Non-paper is like a policy briefs. For example, the Symposium, that's good. I apologize for that.
I think he deserves a very big round of applause. And I want to convey our thanks and gratitude, Professor, for the mentorship you're giving young negotiators. I was part of the recently concluded youth training on climate negotiations, and coming from this background, I had a lot of questions on why is health not in why are we not talking about health? And like he said, there are processes you have to go through. If a topic is not on the agenda, is not an agenda item, it is not bound to any negotiation. So we need to understand these processes as we are pushing health in the UNFCCC processes. And as the country lead on adaptation negotiations, we really thank you so much for the work you're doing for this country, but also inspiring and mentoring us young negotiators. Thank you so much. I think we have spent most of the time learning a lot and also having feedback, so now we are going to the most interesting. Please. 5 minutes? Okay. Okay. Please, let us.
Let's finalize the discussion. We want to listen to what you have in your mind. We have gotten a lot of feedback on people online, huge ideas online, so we're going to incorporate them. Thank you.
I'm limiting the time to be 1 minute. So if you can choose one question from, question 5 to question 4, because the other questions were, so much.
Okay, we shall take question 5, talking about the recommendations health sector should focus on during the climate change negotiations. So we looked at research. Research should be done in order to monitor the changing climate patterns. Then also negotiating for financing and for financing of the climate research and whatever. Then also we have capacity building on climate and health. There is also partnership learning, i.e. this can be done by sharing the best practices. We pick a leaf from the other people and we come and implement it here in Uganda to improve our health in terms of climate. Thank you.
Next one, please. Very faster.
Okay, let's do question 4. Yeah, it was on the key policy interventions needed to support the health system adaptation, community climate resilience. We need to expedite the formulation of NAPA 2, we need a clear policy framework and corresponding implementation plan. We also need advocate for adoption of policies in all sectors to reduce emissions that negatively impact on air quality and public health. Thank you.
Okay. Thank you. The last one, again, they were mostly similar, so we'll focus on 5 also, the recommendations. One was to include health in the L&D, the Loss and Damage Fund, but after hearing Professor's presentation, I think it also would include building consensus from the island blocks, LDCs and DCs. Then the other recommendation was to ensure commitments out of the COP on shared eco-friendly technologies. Thank you.
Thank you.
Thank you. Raymond, that is the last one, okay?
Yeah, thank you. Our table, we are going to present on number 5, and we agreed that as a ministry or as a country, we need to put much emphasis on sexual and reproductive health as one of the core drivers can help us to build an adaptive and resilient health system. Thank you.
Raymond, here, please. These are the last.
Okay.
Here, this. The rest of the tables, we shall engage them after lunch.
So we'll focus to question 5, the recommendations. That is climate financing for health, sharing evidences on the impact of climate change for health action, multi-sectoral partnerships, lobbying for health and climate change onto the UN platform, that's the UNFCCC, and the Loss and Damage Fund onto Uganda. Thank you.
Gotten huge contribution from online teams. We have documented it. We are going to put it within the team. But as the team working on this, we request if we can have about 2 or 3 members join us to brainstorm this afternoon in ensuring we have all the inputs in the one document. So we're looking for volunteers. Can get volunteers to join us, and then 3 or 4 members who can do it voluntarily to give input to this. Thank you. And thank you for the inputs. Teams online, we appreciate it. Thank
you. It is time for lunch.
So we need members to join us. Volunteers. We need your brains, Kindly get to me before we leave for lunch on this table. Thank you. Thank you very much. Over to you, moderator.
Okay, I'm taking over, and I hope no more interruption. Because we are going to have lunch, and our lunch is going to be, it should be very short, because we have more other 2 engagements that are coming, which are quite interesting and very interactive. So please, as you go for your lunch, be mindful of time, and make sure that at least by 2:10 we should all be here. Please. Please, I know we are soldiers, we are all health professions, and please, but be mindful of time, and let's try to keep it within means.
Okay, so our first panelist today is Ms. Hajra Mukasa, a holder of Bachelor of Environmental Health Science and Master of Public Health from Makerere University. She's a public health specialist with expertise in program management for the past 18 years. Currently, she's a program manager for WASH, and she provides technical leadership to water sanitation and hygiene and neglected tropical diseases, climate change and public health at Amref Health Africa in Uganda. She also leads technical backstopping of all programs to ensure that the implementation is cognizant of community education, climate change, public health emergencies, and livelihoods as key social determinants of health. Colleagues, let's welcome Ms. Hajra with a hand clap. Our second panelist will be Mr. Jackson Chekweko. He's a demographer by profession and statistician by background, and currently is the Executive Director of Reproductive Health Uganda, an affiliate of International Planned Parenthood Federation, IPPF. Let's welcome him with a clap. We have Dr. Betty Chadondo. She's the Director of Family Health at the National Population Council in Uganda, and is currently spearheading efforts towards getting Uganda on the trajectory to harnessing the demographic dividend. Betty is a Collen Fellow of Oxford's Institute of Population Aging, medical doctor and demographer. Betty is a researcher and part-time lecturer at Makerere University School of Public Health. Let's put our hands together for Dr. Betty. And lastly, we will welcome Emmanuel Mulisa, who is a youth climate negotiator under Ministry of Water and Environment, and coordinates programs and partnerships of the National Youth Council of Uganda. Let's clap for them. So our discussion today, Melissa, you could, for purposes of balancing the, great. So we'll start with Hajra Mukasa from AMREF Africa, Uganda. And she will be speaking to us about capacity building opportunities for health workforce in climate change and health. So, Ms. Hajra.
Thank you very much. A very good afternoon. Welcome back from lunch. I hope the lunch will energize us as opposed to consuming our energy. Like I was introduced, I work for AMREF Health Africa in Uganda. AMREF is an international, the only international NGO that was founded in Africa to solve African problems, co-creating solutions with communities of Africa. We've been around since 1957, and moving forward 2023 to 2030, our new strategy is very aware of climate change, community education, youth involvement, and livelihood as some of the social determinants of health that we must pay attention to if we are to commit to our vision of lasting health change in Africa. We're also aware that for us to thrive in the face of climate change, then we have to pay attention to the health system. And capacity building of community health workers and healthcare facility workers is one of the key aspects that we believe that we need to strengthen as one of the pillars of health systems, the human resource. With funding from Rockefeller and with funding from other partners, we are doing capacity building in a big way in Kenya, but also in an integrated manner in Uganda. One key thing that we are aware of is the alienation of climate change, especially when it comes to health workers. Everyone here will agree with me that if there's one person that is respected in communities, it's the health worker. So what this health worker communicates matters a lot. And so we are aware of that. We're also aware that the health workforce is not as ignorant of climate change as we perceive them to be. It's just us drawing attention, awakening them to pay close attention and to make the connections and the relations between climate change and health. That's the intersectionality. So in addition to building capacity as a means of health system strengthening, we also build capacity of these health workers to be able to pass on the messages. And these messages is not just about this is climate change. One thing we appreciate, especially working with the community health workers, is that the community that we work with don't even understand the word climate change, but they feel the impact and the effect of climate change. So our capacity building is built along those lines. We do best fit packages. We use the WHO. WHO has got the 17 modules. We cannot deliver all those modules at once. It's just best fit content. Now, when we're doing our capacity building, so someone was passionate about One Health this morning. Our capacity building takes an angle of One Health, so that when we are delivering messages and when we are empowering the community health workers to be able to talk to communities, to educate communities, especially during the community dialogues. One thing we are aware of is that we cannot just bring this model and tell people this is climate change and this is all that. It's about thinking about best fit. What is it that happens in this community that we think is associated with climate change that we think we should address? In some communities, you'll realize that for them it's about resource recovery, things that they've lost as an impact of climate change. I know capacity building, thinking about what we gain in future, would not be palatable to most people, but in some communities it's about what is our gain for the future as we build capacity. And so these health workers, it's not about just passing the message, like, oh, so you know, we have a surge of this disease outbreak, like where we are in northern Uganda, we are having a surge of malaria. True, we've had malaria in northern Uganda, but it's becoming really, it's a bit overboard. It's not about telling them, okay, now you have this malaria because of the adverse weather conditions. The health workers have to have the capacity to tell people what to do within their means to be able to mitigate these effects. And so it's not just about passing messages, oh, this is climate change, it's about what we can do locally. And as for the community health workers, giving them the knowledge and skills to be able to provide solutions, and not necessarily solutions that may be quick fixes, but solutions that can be implemented with communities. And then what we do, especially in the model of mitigation, we call them developing model homesteads and ideal homesteads that result into model communities, that every community health worker has the capacity to educate households that are clustered to be able to put up certain things that can help them mitigate the effects. Things like we do, for community level, we do very basic things, like what should an ideal homestead have? We know that climate change is there and there will be adverse weather conditions, but how prepared are we for droughts and how do we therefore store our food? Key thing we do is we never introduce new knowledge that is not sustainable. We've seen it works when you pick on the old knowledge that had been abandoned. We know in these communities people used to have granaries. So these are things we are reviving, building skills of community health workers to be able to teach people to do the same. And also when it comes to how do we survive with less firewood but still be able to cook food, teaching the community health workers to be able to still, and the extension workers to teach people to make the low energy saving stoves, but then not telling them not to cut firewood. They'll still do it, but then let them at least use a third of what they would have used, but also benefiting from other health benefits of making sure that a woman does not cook from a very congested kitchen. Then we bring in the aspect of sexual reproductive health and rights. And it's not, we do not use language of sexual reproductive health and rights, but then these are like using a tangible output like a water source, telling these people, okay, if you really want this water source, then this is what we have to do. Can you have separate sex accommodation for boys and girls before we can give you this water source? So can each household first have these basics that enable them to thrive in the face of climate change?
Thank you so much indeed, Ms. Hajra, and I will look back to you a little bit later. I wanted to skip and first speak to Emmanuel. Emmanuel, I want you to briefly take us through the role of youth in building climate resilient health systems. If you can do it in 5 minutes, you'll get an opportunity a bit later.
Wow. Kindly help me switch off yours such that the echo is not. Yes. Thank you very much. A very good afternoon to all of us. I'm first of all very happy to be the old man out on the panel. I think I'm the youngest. Yes. But first, I want to build, yes, I am the youngest, yes. Everyone else is young, but I'm the youngest. So First of all, on the role of youth in building climate resilient health systems, I want to first build context, starting with who is even a youth. Now, different regional bodies define youth differently. For example, according to the laws of Uganda, a youth is between 18 to 30 years. But according to the UN systems, a youth is from 15 to 24 years. But again, also according to the African Youth Charter, that is the African Union Commission, a youth is between 15 to 35. Now, you might be here, if you don't fall in any of those categories, then you are certainly not a youth, but you are very youthful. So, you're very youthful, yes, and we also welcome youthful people to help us in the youth cause. So that is basically a youth, basically defined according to age. But now, I'll explain 3 reasons regarding the role of youth in building climate resilient health systems. And number 1 is the participation in environmental advocacy. Now, if I'm to delve deeper into this particular aspect, for many youth, the journey begins with, first of all, understanding, even just the difference between what adaptation is and what mitigation is. So many youth are very creative. They implement a lot of projects that even involve collecting just waste and making briquettes, but they don't know what that contribution is towards environmental protection. Where does it lie? Is it in line with mitigation or adaptation? Because when you understand this climate change language, there's a huge difference. So you must either be contributing to one of the two. So every effort lies there. But the topic here I was given is basically on building climate resilience. Now, climate resilience, how you build resilience is first of all being successful at adaptation. If you're not successful at adaptation, you're basically going for loss and damage. I know that is the language you've been interacting with already. But first, what is mitigation? Mitigation just involves reducing greenhouse gas emissions. Youth might not have a lot to do in that line, but where the youth have more to do is in adaptation. And why should we focus on adaptation today in terms of our role as youth in this contribution? Is that once we are successful at adaptation, then we shall help our communities build resilience. Now, there are so many ways of building adaptation. Now, adaptation, I don't want to focus it only on health, because once you adapt, we all know that climate change has a direct impact on public health. If there is climate change, then there is definitely going to be a huge impact on public health. All those extreme weather events and all that, they have a contribution, a direct impact on public health. Now, if you adapt successfully in so many ways, now this is where, because I'm also a youth, this is where our youth, as the youth, have to contribute through adaptation. Now, there are so many ways we can be innovative as youth. Number 1 is building infrastructure resilience. Now, if I was to explain adaptation involves enabling the community to cope with the challenges, living with the challenges, building capacity to cope with the challenges that have come as a result of climate change. Now, one of the ways we can be successful at adaptation is building infrastructure that is resilient. That is roads, homes. Even the Bible has a story where they say that a house that was built on the sand collapsed and a house that was built on the rock stood firm. So even when you're building infrastructure, build it in a way that it can withstand the shocks. There's early warning systems, yeah? Much of the impacts we are facing is because we don't get communication very fast. That if we are to evacuate people from this area, maybe there's going to be a flood, we don't get that information quickly. So by the time the flood comes, people are already impacted. Quickly, there's so much agricultural practices, how you use the land. If you go deeper into those studies, you know that us as the youth have a role to play. How you use the land has a direct impact on climate change. So there's quite much that we can do to reduce that vulnerability through adaptation.
Thank you so much indeed, and we'll look back to you. So Emmanuel mentioned a very important point on, he said building resilience requires successful adaptation. And Mr. Jackson Chekweko has led reproductive health Uganda, but also importantly led reproductive health events. So we'll be listening to him, and he'll be telling us about reproductive health and climate change adaptation and the interlinkage between SRHR and climate change adaptation. So,
thank you, Andrew. My name again is Jackson Chekweko from Reproductive Health Uganda, and I'm seated here to share the interlinkage. Quite often it eludes most of us when we are talking about climate change and somebody is talking about sexual rights. We get lost. We have been in this for a while, partnering with various organizations, National Population Council on Population Health and Environment, WWF, in trying to build resilience, especially among the vulnerable communities in the prone affected areas, working with Danish Family Planning Association to build capacities, understanding the interlinkages. Now, the discussion is just to emphasize on some of the critical areas. One of them is, how does climate change affect the sexual and reproductive health life of a person? I want to say that if, for example, drought comes, which is caused by climate change, some people will be affected most, and that is women, young people, children. Take, for example, just to bring us to the reality, in Uganda, when drought comes, quite often women travel longer distances to collect water for domestic use because the rivers has dried up, the streams have dried up. What is the implications on the young people, on that adolescent girl who goes to collect water? What happens is that the young boys take advantage, and this comes along with challenges of rape, challenges of defilement, and among others, you will see these young people dropping out of school. Take, for example, that is water. The same thing applies to firewood. You will see a pregnant woman going a long distance to collect water or collect firewood. By the time she comes home, the children at home have gone hungry because in some places they go even for the whole day. So how does the people planning on issues of climate change think about that vulnerable woman? A professor was talking about the negotiations. I was keenly hearing whether the health components are going beyond to reach out on this. And this is where the gap is coming. So the suggestion is, as we address issues of climate change, let's think about the vulnerabilities, especially on the sexual and reproductive health. There is stillbirth, there is increased morbidity, there is gender-based violence. Jackson will come home and ask Madam, where is food? Not knowing that Madam went the whole day looking for firewood and didn't get the firewood. And there war erupts. That is domestic violence. We need to build adaptation or interventions that informs families that as climate change comes, you need quick yielding trees that can bring firewood at home, water storage, and whatever. That's the thinking. Then 2, it brings us to population, health, and environment. We have a simplistic approach of thinking that in order to address concerns of climate change, we need to do family planning and reduce the population. Now, our thinking is at all times we need to use the rights-based approach to addressing issues of climate change. Let's focus on the challenges that climate change comes along with, as opposed to thinking that we want to protect the environment by doing away with the people. Which one should we protect? Is it the people or the climate? Which one comes first? So it is planning to increase gender equality. If women are empowered, if we promote gender equality from the word go, then we shall build sustainable communities that will be able to cope with the challenges of climate change. I don't want to take it long. Thank you.
Thank you so much indeed, and that was amazing, really. So Dr. Betty will wrap this up by now bringing into the concept of population growth and climate change. So, Dr. Betty.
Thank you very much. Sorry, I have a cold, but I'll be able to communicate. And I'm very privileged to be here. I am also still very youthful. In my own eyes, yes. So I think most of us are looking at how climate is impacting on health. And taking it from where Jackson, I think he has commented a little bit on population. What should we address first? And for me, that is where I'm going to come from. And I'll give a little bit of statistics for us to try and appreciate that there's a very, very big impact that arises from the rapid population growth this country is facing on the climate. So if we understand that, I want to disagree with Jackson for a bit. So not on the rights-based approach, but on which one should we address first. So rapid population growth, there is no doubt, increases pressure on so many things. And for us from the Population Council, our purpose is to ensure that we contribute to having good livelihoods for our people. And livelihoods means, I'm sure if any of you has asked what is it that you need in life, you'll say money. So it is development. So what we have been doing for a while is to bring out evidence on the impact of population and development. And we have used different models. And environment is part of development. Climate change really affects development. So that is the work that we are doing. And we have to know that every time the population grows, and it is growing rapidly in Uganda, because fertility continues to increase. A number of you have talked about the challenges we have with early marriages and teenage pregnancy, which all fuel high fertility. And this really results in us determining the rate at which the population grows. And then this rapid population growth definitely has an impact on land under cultivation. We have seen and we've had wars in different parts of this country because people are fighting for land. So there is land degradation, there is soil erosion, there is deforestation. There are so many things that will come on the soil just because of that impact of a high population growth. And this definitely will affect productivity. We have also seen, okay, let me just give two statistics. The model that we use to show the impact is called the RAPID. And RAPID is a resource awareness on the impact of population on development. So in terms of food security, because that is the one I started with, when this model was run in 2007, it predicted that, okay, it showed that in 2007, Uganda needed 21 million tons of food for the population then. And it modeled that if the population continues to grow, business as usual, the country will need 65 million tons. That is 3 times more food that they required then by 2040. So where is this food going to come from? We're going to destroy all the natural resources to find space where to grow the food. And this has very serious impacts on the environment as well as on the climate. Then 2, I'll also use another example of the wood that we use in cooking. We consume food, rather we consume wood, we destroy forests in order for us to be able to cook our food. And Jackson put it very rightly that women have to trek those long distances just simply looking for firewood. Many of us in this room, we probably don't use firewood, but some of us are using charcoal. I'm sure a number of people, I see many vehicles when I'm moving along the roads are all packed with charcoal sacks. So the consumption that was required for Ugandans to be able to cook food by destroying forests, either to use it as charcoal or firewood, was 12.1 million tons in 2007. And by 2040, it would have increased still 3 times to 39.5 million tons if fertility continues to grow at the same pace. But if fertility declined, and we are addressing issues of population before we get the impact, it will decrease by 27.8 million. So we can clearly see if we don't address the population, or if we don't address it as a challenge, then adaptation, mitigation are going to be a challenge. And I think for me, the first thing we need to start with is mitigation. We need to put measures in place. And this is why, as a National Population Council, we are working in partnership. Jackson has talked about the population, health, and environment. And we are now shifting goals to start thinking about population, environment, and development, other than just speaking about population, health, and environment. Because health is a component of population. How much information do you give for people to appreciate that when they adopt certain behaviors, it is going to help them live better lives by not destroying the environment? We do engage with various stakeholders, including members of parliament, but also leaders at local government levels, to just let them know when they are making their plans and budgets, can they integrate these issues in their budgets? We also engage in the communities using the PHE model to just sensitize communities about what are the likely impacts. We are looking at the current, but there are going to be grave impacts if we do not address population as a challenge to mitigate the climate change. So let me stop here for now and appreciate the opportunity that I have received to speak to you.
Thank you very much. So those were our physical panelists. We have one more panelist before we open it up to you all. Allow me to take this opportunity to invite Karina Hash. I'm not sure if our tech team is ready to have her in. Karina, are you able to hear us?
Yes, I'm able to hear, and I'm able now to be unmuted. Please let me know if you can all hear me.
Thank you.
some
We are
of
able to hear you, and yeah, you could. You have about 5 minutes before we can open it up to the general team here to give their views. So, proceed.
Thank you so much. Thank you so much for having me. It's really a privilege to be invited virtually to speak to you all today, and to have got to listen to the panel just before me, which was really fascinating. So I'd like to introduce the organization I work for, and then reflect on some of the points that the colleagues have mentioned before me. I work in policy and advocacy at the Margaret Pike Trust. And very briefly, we are an organization with over 50 years of history in sexual and reproductive health and rights. And we are also the only member of the International Union for Conservation of Nature and a UNFCCC observer organization who has this type of history in sexual and reproductive health and rights. So I just wanted to give that sort of snapshot to give you a sense of what kind of organization we are. But we work programmatically and at the advocacy level, and we have a very deep commitment, and a lot of our activity is focused in Uganda. So again, really appreciate being present in the Health and Climate Change Symposium ahead of COP28 with all of you. At the programmatic level in Uganda, we've been working for over 3 years now in southwest Uganda to restore the wetlands, to save the great-crowned crane, your national bird, but at the same time improve the health and the livelihoods of the communities in this part of southwest Uganda. And a bit like the colleagues were saying, what do you do first? Do you work on the wetlands? Do you work on the cranes? Do you work on the people? And the importance is to work on everything simultaneously in an integrated manner. And that's very much what we've been doing. The program that we are implementing together with partners on the ground in Uganda is funded by the UK's Department for the Environment, which is very significant because it was the first time that such actions, specifically around sexual and reproductive health, including family planning, were part of a Department for the Environment funded program. And that's very significant. And one of the reasons it's significant, because as the colleague was saying, for example, the health workers are such an important figure in communities in Uganda, and the communities listen to them. So something that's been done from the very beginning of this program is that the community health workers go into the communities with integrated messages. You're right, someone doesn't necessarily know what climate change is, but what they do know is that their soils are not as fertile, that they're having to walk longer distances to fetch water, to fetch firewood, as the colleagues already said, and they're seeing those negative effects reproduced on themselves, on their families, and on their farms, for example. So it's about making those messages very accessible to people. And they are seeing the effects of climate change on their health. And in particular, they're seeing the effects of climate change on the sexual and reproductive health. And I think that's a big area of focus for us. But we talk about removing the barriers to family planning. I take the point of the colleague from the National Population Council about what you're seeing, the effects of population growth on the environment. But what we advocate for as an organization, and what we implement in our programmatic work and in our advocacy, is that if you were to remove the barriers to rights-based and voluntary family planning, then many women and girls who are experiencing these issues that Jackson and others have put forward, then we would see women and girls would choose to take up family planning methods if they weren't able to do so. And to flip the argument around, we see climate change impacting sexual and reproductive health. I think what we should do now as a community, and to some degree, I think Uganda really leads the curve on this, the fact that you've integrated reproductive health programs in your national adaptation plan, in your NDC, and also as your national priority adaptation targets, is let's, as we think about going to COP28, and when the negotiators and others are going to speak about what are gender-sensitive and transformative approaches to building resilience and to building adaptation, as the youth colleague mentioned, what does that look like? And we can make a strong argument as a community here, because we've done that awareness raising, we've communicated the evidence that access to sexual and reproductive health programs, initiatives, they are a fundamental pillar of climate adaptation and therefore will contribute to building communities, individuals and communities' resilience. And this is really important in a country like Uganda. And let's please remember, as we go into COP28, and there was discussion about mitigation versus adaptation, the whole continent of Africa only contributes 2% of global CO2 emissions. So I think that's an important starting point. Yet at the same time, with this huge global climate crisis, there's a gender crisis, there's a reproductive health crisis, and these are grave injustices that these people, these women and girls who have to go collect the firewood, they are on the front lines of climate change. They know what climate change looks like, and I think it's important to communicate that, as the colleague was saying. What are the negotiators thinking about? They need to have those women and girls, they need to have that picture painted that the colleagues painted so well. So we're very proud to be working with the National Civil Society partner, YADNET, represented by Mr. Royuka here in the room with you today, working with Raymond and working with other national partners to make sure that the amazing work that's being done in Uganda is communicated, both the programmatic work, but as well as the advocacy is communicated in global platforms such as the IUCN, the International Union for Conservation of Nature, through a task force that we chair, as well as in the UNFCCC platforms such as the upcoming COP28. So we want to continue that important work with the partners in Uganda and continue to elevate the good work that's being done. So I want to thank you very much. I think I'll stop there for now, and happy to answer any questions and reflect with the other colleagues. Thank you so much.
Thank you so much indeed for the insightful discussions. And at this point, I want to open it up to the gallery and our participants here. If there are any specific quick asks you have or additions before we get back to our panels.
Please, we are doing this very fast because we have another panel coming.
If you have, quickly put up your hand and.
My question goes to the youth colleague. You talked about the youth not knowing the difference between mitigation and adaptation. So I would like to ask, what are the measures you guys have put in place to ensure that the youth are actually involved and they're active in climate and health and everything involved with advocacy and sensitization?
Thank you. Another colleague? Okay.
Thank you very much. Even after lunch, I'm still Dr. Christine Navidio from Perth, Africa. And really, Emmanuel, we'll have a chat after this. Last week, I was honored to represent at EDCTP. That is the European Developing Countries Clinical Trials Partnership. I'm a vice chair at the Stakeholders Forum. And I'm happy to tell you that our own Dr. Michael Makanga is now the executive director of EDCTP. All the researchers in the room, you could clap. So I was proudly Ugandan in Paris, and I'm proudly Ugandan in Kampala today. Emmanuel, moving out of my hotel, l'Hôtel d'Est, at the Gare de l'Est, I met this young girl called Mary. And she was, Madame, Madame. And I said, in Uganda, when you hear Madame, Madame, it's somebody and a young person, they're asking you for money. So I said, what is a young European girl doing on the winter streets asking for money? Then I said, my French is ampu. So she said, Anglais, Anglais, okay. I am from Greenpeace. Greenpeace? We are talking about environment. I said, oh, I'm going to Africa tomorrow and we have pre-COP. Can I take a picture with you so that I can show Emmanuel what should be happening on the streets of Kampala? We should have marched here. The youth, me, I'm 60 years old youth. Eh? But you should have matched here in blue and green. They were in blue and green, and I looked around the whole thing, and it was blue and green youth. When are the youth going to march in Kampala and Masaka and Mbale and in my village, Jumbi, Gomba district? If there's any youth group that is doing that, thank you very much. Didi, demographic dividend, and the youth, please sit. Sit, and you, Chekweku, sit, and Amref, me, I've been Amref. Let's sit and get this properly done. I haven't heard about coordination of partnerships. If we are not coordinating with each other, if we are just fronting path, and just fronting, what are the ones they talked about you? So many of them, Chekweku. If we are just fronting each other, I mean not each other, but fronting me, path, we are not going to move. In Africa, we need a voice that is one voice as all partners. So as Ministry of Health goes to COP, can we have one voice? Can the Ugandans do it differently? As here positioning with Herbert, then after that somebody else is positioning with Herbert. Can we position as all of us as pre-COP, and we go to COP to speak with one voice as the partners? And can the youth partners hear? I hear, what are the, collected many cards, my partner here. Can you get together? With Uganda, 75% youth. If you march in Kampala, you march in Masaka, you march in Gulu, you march in Kapchora, this country will wake up. Abazukulu.
A question.
The National One Health platform, because it is there, and actually I want to argue out, because I remember one person was saying it is more of human and animal, but then we have environment, which is a key aspect when it comes to climate change. So I would call upon environmentalists. Please, no one is going to come to push you, because the veterinary people did that, the health people did their part. And also you also need to be so aggressive that we fit into this One Health approach so that we have the climate change aspect addressed well. Thanks.
Thank you very much. And allow me to stop. Okay. This is the last question, and I also give my comment, because every time you're giving comments, questions, and I don't.
Okay, thank you. I'm Andrew. I'm glad that Tree Adoption brought this conversation. And my friend Tuliakile is over there. We have always had this conversation. I come from a health background. We have always had this conversation, and I've been telling people that there's a nexus between health and climate change. I'm glad that we are having this conversation. But my issue has always been on, people have always been talking about climate change and thinking that those are the issues of only climatologists or environmental defenders. But climate change is huge, and it affects everyone. It actually presents a fundamental threat to everyone. But the issue is that I don't know if we are ready to invest in research. My issue is on the, if you see the rising cases of cancer, how sure are you that many of the cases are linked to climate change effects? I think going forward, I want to ask the Ministry of Health and the relevant stakeholders that how prepared are we to invest research on the effects of climate change on human health? Yeah, thank you.
Thank you very much indeed. So, can she give one last question?
Oh my God, okay. Let me give mine. Let me give mine, as she also prepares hers fully. And mute yours, mute your microphone. Yeah. So for me, I'm a firm believer that climate change is a topic that we cannot just tackle from one sector. We need a whole system approach. And I've always said, and I'll continue to say today, that we do not need cosmetic treatment towards climate change. If I'm to bring it in medical terms, I usually say that we need a whole open heart surgery to the systems that are existing, not only in our governance, but also in our existing other systems of life. We could argue our political, we could argue our transport, our education system. Climate change or climate crisis poses an opportunity for us, not only as Uganda, but the whole globe, to think, to think and reconstruct our systems, how we're operating. We can see that the mode of, the means that we've been using for transport are destructive. We can see that everything that we've been using needs us to first pause and see, how can we change this? And for me, the reason as to why we are moving slow is because we are so stuck in our systems that we don't want to get out of them. The moment we realize that we need structural changes in how things are operated, I think it is going to take us a very fast approach towards tackling this issue of climate change.
Just to add on to that, thank you, because with a youth here, you mentioned innovations, you mentioned how, and then also someone from the floor talked about marching on the streets. It just made me think that in addition to having that multi-sectoral, multidisciplinary approach, we need to be aggressive if we are going to see change. We need to make those linkages in the community, even here where we're sitting, and everybody has a bottle of water or 3 during the day. If we are going to really say that we're going to make a difference, let us bring those innovative ideas to COP. We are not just going for we're not just going to have funding or look for solutions from the top down. We need to present this, and I think our hope is going to be in the youth. If we can actually walk the talk, I think then we'll be making some progress. We should be aggressive and say, come with different ideas. We're not going to see more use of plastic like we're seeing here. We're just going to make the correlation, how this is impacting on our health in the communities. So, thank you.
Kindly, please reserve your questions. We are going to have another panel so you can chip them in.
Thank you very much indeed. I want to look back to our panelists. So you can respond to what they brought up, but at the same time also give your closing remarks. So we may not look back to you, so we can do 3 minutes each.
Thank you very much. To pick it up from the aspect of capacity building, targeting in-service healthcare providers, I think the collaboration that is being emphasized here is something we can lean on. As AMREF, one thing that we know that will help us to accelerate this, through our Institute of Capacity Development and AMREF International University, we are piggybacking on what WHO has to come up with syllabi that will, one, we want to target people in school, then the pre-service. In Uganda, we have pre-service, I think, like the intern. So wherever someone will be found, their capacity will be built from there. But now, as AMREF, we're just one thing, we're just a small pocket. So as government starts thinking that, just know that AMREF is already thinking that, and so we can support each other because we already have that in the factory. We're working on that. And just to agree with everyone, for us to really push this agenda, let's not look at climate change as this alien that should happen out there. Each time you have an opportunity for continuous medical education, opportunity for community health workers education, please integrate the messages in there because we don't want an issue of having pockets of different people trained in different skills, but also we don't want issues of alienating the message so that even the recipient of the message thinks this is so strange and so unique for me to handle, so that it's easy for them to pass on this message to the communities. And always remember to have very simple reference materials for the people to make reference to. And still I emphasize, introduce new knowledge and skill with caution, because there's a lot of indigenous knowledge and skills in there that were somehow abandoned, that we can ride on to build capacity of people to be able to support our people. Thank you.
Thank you very much. I didn't get questions, but I want to agree entirely what Karina said. And I want to tell my colleague Betty that we are not disagreeing. We need to look at climate change from a holistic perspective, but having a rights-based approach to the solutions we propose. Without that at the center, one day a policymaker will wake up and say, one child per home, because we want to protect the environment. And people will be up in arms. I want to tell you, they will cut all the trees, and it can even reverse the efforts we have. So the issue of a sustainable approach. Then two, I just want to emphasize, and this is what we have already initiated in 7 districts in Rwenzori region and part of Ankole. We need to work with those VHTs, those community resource persons, because they present these issues in a very logical and appreciable manner. Build their capacities and they will be in charge, and they are creative, and it's the most sustainable approach. The other one is that let's not focus only in COP in Dubai. Let's, like the previous speakers, let's talk about the national level, and that's where our advocacy comes. If government, for example, says to sustain the environment, we need tree canopy along all the roads, how much trees will that be? And how much shall we enjoy that? Let's focus also at the local governments. And like I said, we've piloted in 7 districts. They are doing amazing work. One of them has already even adopted the action plan for their district. And they are a best practice to learn from. Integration is key. We work with WWF. It took them time to understand, looking at integration of SRHR. But from the time we were on the same page, we are doing amazing work together with National Forest Authority, Wildlife Authority, and I think that's the way to go. Then the young people are the game changer. I wanted Raymond Newstan, just for a minute. This is one of the products of RHQ. When he was just a young person, we put him at the center of driving climate change integration with SRH in RHQ. Look at where he is today. This is living testimonies of how young people can move mountains. Thank you so much.
I think a lot and everything has been said. For me, I'll just say 2 things. One, this is a preparatory meeting for COP28. So do we already have plans after COP28? What next? And I think good mobilization has been done. A number of partners are here. And we're already saying there's a lot that we can do. We need to work through the systems. So I think before we leave this meeting, can we agree on when we are coming back? Well, I don't know whether it will be the same hotel, but after COP28. So what have we learned? What are the things that we can do differently, listening into the discussions from the other countries. And then two, we need to engage our policy and decision makers at a higher level, to engage them in advocacy, to ensure that they support this with sustained financing. Because I already saw one of the gaps that we have, a major gap, is financing. So this discussion is just beginning. And I think we need to sustain the momentum of a discussion and be intentional in ensuring that we create impact from the discussions we are already having. Thank you.
Yes, thank you, moderator. I think I received both questions and concerns, so you'll give me extra time. Yes, well, thank you very much. But I'll start like this. Whether we have food insecurity, whether we have water scarcity, it has health implications, right? So earlier on, though my presentation was cut short, I was still delving into how, what role the youth have. And before I even go to answer the questions, I think I want to first conclude on that submission. Then I'll feed into whatever was asked and the concerns that come in there. So there are three areas I outlined. One of them, which was in participating in an environmental advocacy. That one, I think I broke it down earlier and said we have adaptation and mitigation. And then I said, as youth, we have a lot more to contribute towards adaptation systems, building adaptation in our communities. In that, we shall now end up building resilience. I think I explained that earlier. But then, the other reason that I wanted to give, or the other role, was that as youth, we have a role, a very big role in promoting sustainable lifestyles. What do I mean by this? Sustainability basically is about you meeting your own needs, but you don't compromise future generations in how they will access their own needs. That if you destroy a wetland today, if you reclaim a swamp, how do you think the future generations will live? How do you think they will survive? You will have cut out on that science of rainfall formation. Yeah? It is also important to know the climate science when you're in this particular field. That if you don't live in a sustainable way, yeah? If you do not conserve biodiversity, if you do not restore ecosystems, then the future generations that will come, even after us, we are young today, but after us, nothing will, how will they survive? So that is another role that we have key to play. But then thirdly, and lastly, engaging in climate smart innovation in the health sector. Yes, even the healthcare system also needs adaptation because we have changing patterns of diseases these days because of climate change. We have heat waves. So we need a lot of innovation in that regard. Innovation, youth have been doing well so far, but they just need more capacity, right? So that they can build more innovations in building more smart agricultural practices, in establishing early warning systems such that we help communities. If we need to remove a community from an area, then we remove it early, such that we don't now start responding after a disaster. Yes, because of time, I'll stop there. But just to answer the questions that came in, my sister there said, what measures are we putting in place to ensure that the youth are aware of even this climate change? Well, this is not a single role of a single entity. I think that has been addressed by different people that have submitted. There are youth organizations, youth-focused organizations. There's the Ministry of Water and Environment. There's the National Environmental Management Authority. There are so many NGOs that do a lot of climate work. And I think because this has become a global crisis, so much work has now been directed towards informing young people this particular aspect of climate change. Then to Doctor here, and this will be my last one, I think even in France, I just want to inform Doctor that Uganda boasts of some of the biggest environment activists or climate activists in the world. I will not mention names, but there are quite many. I believe even in France where you are, there were some Ugandans there. Some young people in the room will agree with me. There were some Ugandans there. On the question of marching, well, that idea does not work well in Uganda, especially when young people are marching. But why? Huh? Why? But we shall still continue to have engagements. We shall still try to convene young people such that they get this kind of knowledge, and then they will advocate from an informed point of view. But thank you very much, Doctor, for your questions.
Thank you very much indeed. A very big round of applause for our team as they go back to take their seats, and we'll proceed with the next program. Thank you so much.
Oh, sorry, we forgot someone online. Okay. Karina, please, your closing remarks in just 1.5 minutes. IT team, please. Meanwhile, to re-echo one of the key issues that really a lot of them stood out for me, but this one caught me so much. And I will re-echo one point raised by Hajar, where she mentioned best fit modules for specific geographics. I think this is very important, especially if we're talking about the CSOs and international organizations. We tend to bring modules from the global north, and we expect that what is working the other side is ultimately going to work here. It is not working, my friend. We should build on the knowledge of our communities, and we should also study well what our communities want, and we build on those needs and wants such that we have, a very good result. So I don't know whether our IT team is able to bring Karina. If they are not, we can proceed with the next item, and we're going to have the next panel. Next panel is moderated by that's brain fog. That's because of working a lot. I think the exercise has been quite exhausting, but we are still working. So, Niona, please, can you come and introduce your panelists? And please be time conscious, because we are aware that some people want to leave in time. Thank you.
Thank you very much, everyone. I believe we are all looking at our watches, looking out for the time, but I really hope that we are going to be very time conscious for the second panel. My name once again is Nakuya Niona Kasekende. I work with Regenerate Africa, Gender, Health and Environment Lead. And I'm here to introduce my wonderful panel. Kindly, one by one, as I call you up, please feel free to come and fill in the seats. I will start with Dr. Christine Nabirio. Yes, you're very welcome. Dr. Christine has a bachelor's in medicine and surgery, so she's a medical doctor. We are very happy to have you. She also has a master's in medicine. She also has a doctorate in public health, and of course, a master's in international business administration. Yes, at ESLESCA. So she's the technical strategy and business development director at PATH, and Dr. Christine has over 25 years of experience in public health, with a focus mainly on sexual reproductive health, HIV, gender-based violence projects, and she also works in their design, management, research, monitoring, and evaluation. And of course, the focus is on Africa, as we have seen, but as well as rural and urban areas as well. So thank you very much. You're welcome, Dr. Christine. And I would love to welcome the second panelist, Mr. Charles Kabiswa. He has over 20 years of experience in addressing natural resource and development issues using approaches that facilitate multi-sector integration of reproductive health, gender, climate, environmental conservation, and regeneration within Uganda and East Africa. So we are hoping to hear a lot on multi-sector collaboration from Mr. Charles. We'll further move on to Ms. Nshimye Angela. She's the Policy and Engagement Officer. Ms. Angela is a renowned environmentalist and public health expert committed to advancing sustainable development and defending the health of communities in Africa. You're very welcome, Ms. Angela. Yes. The hand claps are reducing. I do not know if it's... Yeah, thank you. It really gives a lot of morale. It's not easy to be in front here, yeah? So the last panelist is going to be Ms. Naiga Doreen Bingwa. She's under the African Union COVID-19 Bingwa Initiative, under the auspices of Africa's Centers for Disease Control and Prevention, and she's also a member of the European Union Youth Sounding Board of Uganda. Yes, Ms. Doreen, you're welcome. Thank you. Thank you all. Yes. Yes, Ms. Doreen, we are waiting for you to settle. I think we can actually start. We are going to give a few minutes to our panelists to just talk about their different topics. But of course, I think we'll start with Mr. Charles Kabiswa. Mr. Charles Kabiswa is going to be telling us about advancing and scaling up family planning for climate change adaptation and resilience in Uganda. So he's of course going to also delve deeper into issues around the challenges faced by vulnerable populations, but also he will be telling us what should be done at national, global, and regional levels for these challenges to be solved. You're very welcome, Mr. Charles.
Yeah, thank you so much, Niona. And happy to see a number of colleagues here in the room, and for tree adoption for bringing stakeholders, multi-stakeholders in one house. I know the conversation that are taking place right here are closely linked to some conversations going on across Africa, trying to position health for climate action, including financing. And I won't dive much into the challenges because all along we've been talking about challenges and the risks, and we are all Ugandans. I mean, we are living with the communities. We see how disproportionately climate affects the gender. Of course, women, children, more vulnerable, access to health services are hampered. So I just don't want to get back there because my understanding is that we at least witness a number of evidences. And recently, I actually moved away from when I'm talking to the national colleagues, I don't bring these issues because we are all familiar. But maybe recently we have just done 2 documentaries, which we have titled The Intersectional Lens of Gender, Health, and SRHR and Climate Interconnectedness for the people in the diaspora who don't know or who are still doubting how this health aspect is being impacted. So we are doing our best, and I think for me, from the morning, I've also been updated, like the rest of you, that Uganda is progressing on well, especially to interconnect the sexual reproductive health and the family planning into the climate agenda, and this is the collective effort that all of us are looking at. So it has been a process for some of us who have worked with the conservation NGOs, and also trying to bring the health aspect on board, that internationally, but also nationally, colleagues in the health sector have been so thin on the ground, and we have not positioned well the business case of the health to tap into of course, climate financing. So it has taken us all this long, like you saw Professor Kadu was saying that the processes are not so easy, But I'm so happy that we are now raising the momentum. A number of sectors are seated in the room to discuss the key global issues on health, climate, but also sub-sectors like the sexual reproductive health, family planning, and as well as gender that have conversation have been trending since morning. So we are here to continue the dialogue. Of course, the past COPs haven't been so successful, but again, we think that this is the time for Africa to shine. Our organization has just completed a readiness study, national readiness for Uganda to intersect the sexual reproductive health and FP, including population dynamics into the climate action. But also we are doing similar studies across 5 different countries to consolidate. It's not necessarily a positioning paper, but to consolidate some kind of facts. Because since morning we've heard that we need to continue engaging and we need to continue generating this kind of evidence to kind of bring different non-health sector who are into the climate aspect to board. My worry, I am repeating the word, I know you don't like to hear this, we have moved so slow. In fact, the colleagues in other sectors like the agriculture, colleagues in the environment, these people are a bit advanced, tapping into the GCF funding. I have been looking even at the new strategy for the GCF. There is nothing allocated. From all the previous funding, I think over 200,000 billions that have been given out global US money would not have any money that is actually accelerating or meeting the local needs of the health sector in countries. So I think this is, for me, is worrying. But the biggest problem is we are not positioning health as an adaptation priority until of recent, where the government of Uganda now integrated this into the national determined contribution that most of you have been following on the UNFCCC website. And actually, for me, that is so trending because all reports are like documenting that as a key successful story. Uganda topping the list with Marshall Island and other countries to give almost a comprehensive package. It is one of the best NDCs to focus on the health aspect. So the reason why I'm emphasizing on that is some of you think, these are documents, they are not implemented, but you and me now need to pick that as a key issue. Because you see that having health as an entity, like we have gender action plan and other thematic areas like loss and damage, is not easy. So the national processes matter. So just to have that as an entry point at a national level, for me, that is a significant achievement. That is the roadmap we need to use to engage the national adaptation plans so that now we are able to tap into the climate financing as well to address health system strengthening, climate-proof health services, as well as meeting the needs of women and the men, but most important, the girls who are being badly affected by the climate change. So for me, that is something I can say for now. And thank you so much, Niona.
Yes, thank you very much, Charles. For the submissions, I want to apologize for this mishap, but we would love to add to the men on the panel. Kindly let us invite Dr. Espiridion Tumukurate. He's representing Pathfinder. Please join us on stage. Yes. As he comes up, I just want to share that he's a Ugandan medical doctor and he's also a public health expert with over 20 years of experience managing health services delivery projects in Uganda. So we are happy to have him on the panel as well. Yes. So I think I will be moving on to Dr. Christine as Dr. Espiridion said was in. So Dr. Christine, please let us know any of the learnings that you've had from the national adaptation plans in the region. And in addition to what the audience discussed during their table discussions on the position paper, kindly add on to the key policy interventions that you see fit that will help us adapt very well.
Thank you very much, Niona. And if you hadn't invited Dr. Tumukurate, I would have would have requested you too, because I know this is about our brotherhood and sisterhood. When they read Path, they say it is Pathfinder. When they read Pathfinder, they think it's Path. So we have to always look out for each other in that space. Welcome, Epsilon. I would want to start with the words of Nelson Mandela. Nelson Mandela has many quotes. And is Jude in the room? Jude is a Toastmaster. Toastmasters, we evaluate each other and we time each other. I have the bad habit of going over time. So if Derek, since Jude is not here, please, how many minutes? 3? Okay, 5. Derek, starting now. It is in your hands to make a better world for all who live in it. That's Nelson Mandela. There is another person in Mexico, a bigwig. Who are the rich people in Kampala? Sudir, the Sudir of Mexico. I don't remember his name. But he has said, do not ask what world are we giving to our children, but instead ask yourself, what children are we giving to the world? These two guys are talking about my responsibility. Everybody say my responsibility. Aha, can you look at me? My responsibility. My responsibility. They are not talking about Europe's responsibility, like we look to Europe. They've messed us up. The Americans have messed us up. Whatever has messed us up as Africa. But what is my responsibility? Before I get lost in sorting out those that have messed me up, what am I doing? My grandchildren, I'm about to clock 60. My grandchildren, so I won't tell you my age, but I'm about to clock 60. My grandchildren call me Jaja Mutini. Where is Emmanuel? Hello? He hasn't heard. I'm called Jaja Mutini. So I have the energy that my teenage grandchildren wonder at. And that's why they call me Jaja Mutini. And in Paris last week, listening in at the EDCTP forum, partnership forum, and looking at slides as they were going, we are working on the action plan for 2024. And many of the slides had a lot, the science, whatever we are going to do. Then we came to the capacity development slide. It was as empty, or almost as empty. I said, if we are the EDCTP stakeholders, and the capacity development slide looks like it has. Now the media, please don't quote me. Media, you are my friends, please don't put this anywhere. This is for inside, okay? Otherwise I'll be off the forum very fast, record time. It can't look like that. So I charged myself, Christine Navidio, you were sent to Paris by a group of people who trusted you. Each one of us around here is representing a group that trusted us to be sitting in these seats. And our role is to make a difference. So what did Jaja Mutini do? I said, okay, I'm not waiting for an EDCTP grant, but in Uganda, I know 3 sharp, passionate researchers, women. Irene Bagala, Josephine Birungi, Flavia Matovu. At least those are the ones in my circle of influence. Mark that. We dwell a lot in the circle of concern. Let's dwell in the circle of influence. 3, young men. Dr. Herbert Isabidi. I don't know why Isabidi is not here. Richard, WHO. And then Derek. Derek, stand up for recognition. You are the one representing the rest of the group. And clap for him. I said, you guys, 3 of you Ugandans, we are going to be trailblazers. And we don't need an EDCTP grant to be trailblazers. And we are going to show the world, come EDCTP Forum 2025 in Kigali. We'll fill up the whole platform and show what Africans can do with Africans to build capacity without a grant. Going back to Mandela, it's a charge to ourselves as individuals. What are we going to do? By the end of that day, those 12, we had to spill over and create a new one for the women. And each of the 12 is charged to create their own 12 and their own 12. So I think when I spoke to the Director General, HERA, Health, Environment, Protection, and Preparedness of the European Union, I told him, this group is going to confound you because we are changing Africa using the African style of doing things. We need resources. And if you listened to me, yesterday was Cassandra conference. I was asked to be a panelist for the climate and change session. It's time? Oh, okay, it's time up. Right, so now that it's time up, end of stories, I told them that resources were was the elephant in the room, and that if the resources don't flow now, we are into COVID. History repeating itself over climate and health. But I want to change that statement because when I made that clip, I won't go into that. It's a video, you'll look at it. Now, after EDCTP, I'm changing that. We have the resources. In Africa, we have the resources. The biggest elephant in the room is our mindsets. And I liked the lady that brought that up. That what are the youth? The youth are our hope. My Ruth and my Marvin promised me they'll give me a Genesis in another maybe 2 years' time. What world will my Genesis find? And when Genesis, whether he's a he or a she, is 60 like Jaja Mutini, what kind of world will they be living in? Will they be living like the astronauts we see on the moon having these jackets? Jaja Mutini has to refer to her notes. It is in our hands to make a better world for all who live in it. And I quote Nelson Mandela. Thank you.
Thank you very much, Jaja Mutini. We are very grateful for those words. And I think building on to that, I would love to request Dr. Espiriton to add on to that. The change that we have to make starts with us. So we are the responsibility. Kindly help us understand how women, youth, and communities can work together to build to build climate adaptive health systems. Yes, so. Please.
Yeah, thank you, moderator. Indeed, it has been a long day. I came here at 7:30, and I'm still here strong. So I would just hope we keep alert for the next few minutes as we conclude this. I'm called Dr. Tomokrate Espiriton. I'm a medical professional, as introduced, and currently work with Pathfinder on USAID Uganda Family Planning Activity. So my task is really to talk about building climate adaptive health systems in partnership with women, youth, and communities. Really, before I go further, I would like to also make us all reflect that necessity is a mother of all inventions. You know, where we are, I would like to let you know that building a climatically resilient system is a necessity where we stand now. I think you all agree. If we've been told that temperatures have increased over time by 1.32 and the tipping point is 1.4, what else do you need? To really have a climate that can sustain us is a necessity, not so. Now, I would like to add on that it's madness to continue doing the same things and expect different results. This was a renowned scientist in the names of Albert Einstein. Some of you could have heard. He was a great mathematician, physicist, everything. And those are his words. So, we have to do things differently. Now, before I go to building an adaptive climate resilient system, what is the impact of climate? I will really not say much. It was said during the whole of today. But you know, we expect surges in epidemics. We expect vector-related diseases like malaria, even in highland areas where they were not, dengue fever and so on. We expect new pathogens. You've seen COVID, and others are coming. We expect emergencies as a result of these disasters like a drought or floods. And we expect services disruptions when roads are cut off, when people are displaced by floods. Now, we expect food insecurity. You've seen this in Karamoja and so on. Now, when all of this happens, you have huge movements of people displaced in camps and so on. Now, do you want me to add more on how climate can really directly affect health? This is direct. Now, gradual over time, it also does. You've heard stories of some species disappear. You've heard stories of even some plants disappear, some crops not yield. So this is gradual. People will not notice, but they also happen. Now, overall, we now know that up to 23% of global disease burden is attributed to by environmental factors and climatic change. So, and the question, of course, is how do we build a resilient system? That's where I will go briefly. And to me, I will take you a little back. That Pathfinder has an inch in population health and environment, our programming. We had one of our largest projects here in Kampala, Hope Projects, which was hope of populations through environmental programs around Kampala. And we have championed these projects around the world, especially Sahel, including Ethiopia. So what does it take? It starts with the policy. You need a policy. We may be activists, go to Parliament, present a petition paper for budget. But in the end, we want Parliament to plan for the long term and the other decision makers. And in Uganda, I would like to note that we are not short of this. We have National Planning Authority, pitched on Vision 2040, so we have them. Now, if we have these, are we using them? In health, what do we expect? Scenario planning, what I have talked. What is changing over time and what should we do? Do we expect disease patterns to change? Are we developing vaccines? Are we stocking drugs? Do we expect displacements? Do we have our disaster preparedness and response plan in place to respond to in emergencies? Do we have water, emergency treatment systems and hygiene? Do we have responsive health care systems that can do all of this? Of course, there are challenges as we do this. And some of them is dealing with population that is displaced, crowded, and so on. Raw environmental conservation awareness, you know. Some people may not be on board to give any resources. Financial capacity, that's a challenge. But of course, our policy, we have NEMA here. One would wonder, NEMA is an authority, but apart from fighting rich people who are in wetlands, does it enforce an overall enabling policy? Selectively, it picks things that suit the media and so on. But there is more to that, not so. So maybe this is where activism is needed. If you have such an authority, what do you do? So in short, really needed actions is resilience. Building a resilient health system needs all of this I have talked about. Early warning signs are important. We need data, and certainly in health, that data can be corrected. Epidemiology is one of the departments of Ministry of Health, and we need to be focused on environment. This environment, let's understand it. Environment and health, they are interlinked. One is the result. Environment, health, and climate. Change environment, you change climate. I'll give you 2 examples. Cut down the trees, the environment, probably the climate will go up. Drain the water, probably drought and rainfall goes down. What do we want to reduce? Let's restore our environment, environmental conservation. People talk of reforestation. One tree something is here. Tree what? What's the name?
Tree adoption, Uganda.
Huh?
Tree adoption, Uganda.
Tree adoption is here. If we have to conserve our water bodies, it's another. By the way, then, we've talked of emissions. Can we go to carbon zero? This emission is talked about, but let me break it down. People talk of gender programming. What does it mean to a woman in the village? Can we transition her from firewood and charcoal to gas and having a solar stove? Can we do that? That will resolve a lot of things. Her health is secured, environment is secured. So those are some of the things. We need really to act at all levels. There must be something for everyone. By the way, not only youth. Youth, we like you. We want you to lead because you have numerical strength, you have energy, but you need everybody. We need people who are decision makers as well. There is what everybody can do. In a family, I can plant trees. People can volunteer along the road, and people can maintain what's there. Thank you. 1 minute only. On my road going up country, I see along Kampala-Masaka highway, I don't know who planted the trees along the road. Whether you know our project, I don't know. But incidentally, of late, I see some of the developers cutting them. Those where the trees are in front of their plots, they cut them. I saw this in Buwama, and so now I wonder, where are the law enforcers? Let's take climate and environmental interventions to be public goods. I don't know whether I need to define public goods. I would if there was time. I will not define it. If we saw doing such selfish individuals doing such a things would be reprimanded. And to me, my time is up. But I will end up by saying that Pathfinder is actually supporting building climatic resilient health facilities by piloting some of these with all the features I have said, and probably can serve as a model for national scale-up. I have some action points for COP28. If I don't have another minute, I could say so. Should I say?
Maybe in the closing remarks.
Okay, thank you. So, thank you, and let me stop here.
Thank you very much, Doctor. That was a handful, and I believe there is a lot more to add to that. But I think we would love to move on to the 2 next speakers. I'm just going to be giving you some signals at the side. Kindly, let's keep the 5 minutes as well. So maybe we can move on to Miss Angela. Kindly tell us what are the pathways to air quality integration in the health systems, and so we can be able to adapt to climate change.
Thank you very much. Good afternoon, ladies and gentlemen. I'd like to thank the organizers for the privilege that they've given EACO
that I'm sure all of you are going to be happy to hear about and know more about. I work for EACO, and EACO is a project that was started at Makerere University 8 years ago, non-for-profit, and we close the air quality data gaps to improve on air quality management in Uganda and in Africa. Our mission is clean air for African cities, and we do this by leveraging on technology to foster action from the different stakeholders. What we do at EACO we collect, analyze, forecast air quality data. We know that addressing air pollution has co-benefits for health and climate change mitigation. And we also know that the quality of air has its effects on health and climate change. Referring to His Excellency the President during his independence speech, he said that we need to preserve environmental assets so as to have the key primary life givers, and one of them is air. We know 3 minutes without air, you're dead. So I would like you to fasten your seatbelts and join our journey and be part of our journey to improving air quality management in Africa. I would like to share, before I answer her question, I would like to share some of the few efforts that EACO has done towards a low-carbon climate adaptive health system. One is building and deploying low-cost air quality monitors are designed for Africa, fit for Africa. I was so happy about the conversations from the other speakers talking about what can we do as Africans. As I speak right now, EACO has deployed 191 low-cost air quality monitors. I will encourage all of us to pass on the exhibition table. I think we'll have a moment where you can be able to look at our innovation that was developed at Makerere University to measure particularly particulate matter, PM2.5 and PM10. We have also been able to develop digital solutions for real-time data sharing. We are looking at inclusivity here. I had talks about how do we involve everybody. Some of our digital solutions, I'll start with a mobile app. I'm sure all of us here have smartphones. You can download the QR code right there and you can know your air. You can know your air in your villages because we have monitors as far as Fort Poto, Jinja, Gulu, Barara, Masaka, Mubende, Mitiana, Bujiri. So if you come from there, then you know what is causing your mother or your grandmother to cough every night when the neighbor is burning rubbish. We also have an analytics dashboard that is also used by different stakeholders, researchers and policymakers to be able to make out of the air quality situation in the different areas and also to inform action. Happy to let you know, I had someone testify when they came to the exhibition point that we are also involving the community and those who are not technology friendly by sharing information about insights about the air quality around Uganda via TV now on NBS After News. Those who are used to updates via CNN, please, it is home. It is home. We can be able to look at the air quality insights and be able to get out of our comfort zone and take action. What else have we done? Of course, establishing partnership to foster awareness and education, where we work with local government, where we work with researchers to be able to feed us with evidence and inspire us to be able to come up with action. We also, under this different stakeholders, we also work with the youth, the schools, to be able to uptake air quality data and also influence behavior change and contribute to some of the mitigation measures that can improve our air quality. So what are some of our proposed pathways to air quality integration? So we think data standardization would be good, because if we have standard like formats and protocols that ensure sync between like air quality data and health system, this can be used by the health professionals to be able to make out of the impacts that there is on the health system. Then the other thing we propose would be research. So collaborating with the different researchers and epidemiologists to be able to conduct studies and analyze relationship between air quality and health outcomes can also help to inform our policy decisions and healthcare strategies. Oh.
Don't worry, we can have.
Thank you for that.
We just want some questions from the audience too.
Okay, that will be fine.
Sorry. Yeah, I'm just seeing time is running short. 3 minutes to 5 o'clock. Yeah, so we just want to get maybe the last few remarks from Miss Doreen. Kindly, they've already talked about the youth. So kindly tell us, what other innovative initiatives are there for the youth to be able to build capacity in the health systems, specifically the health systems? Yes, how can the youth contribute? Just in like 3 to 4 minutes, since the others have taken up your time, sorry, but yeah.
Our fellow advocates for change. My name is Nega Daring. I want to start my presentation. Today when I was coming for the health and climate symposium, I have a 9-year-old cousin, very little, very inquisitive. She asked me what I was going to attain. And when I shared with her what I was going to attain, she asked me, okay, if you're coming to attain a symposium, how is it going to impact the world? This was able to bring me back to the memory base in the early years before Africa got independence, how our forefathers had a dream. But this dream, they couldn't do it in their spaces. They had to get out of their comfort zones to go and speak, get heard, so that change could be influenced. And these are the spaces. We are carrying on the dreams of our forefathers. And me standing here talking to a room of vibrant young people is a testament of their commitment to seeing young people being at the front line. And in advancing the health and climate agenda, on the role of young people, we cannot re-emphasize that in a population of over 49 million people, where 78% of it are the youth, this is able to bring to my understanding that young people are not only the present, we are the future. Recalling the words of Dr. Ahmed at the Africa Climate Summit, where I had an interview with him, he was able to make me understand that they always told you in school that you are the future. No, you're not. You are the present, because what you do today is going to influence tomorrow's future. So we, me and you, seated in this room, whatever we are speaking here is what is going to influence tomorrow's future. And that's the future my little cousin Shona will be able to enjoy, enjoying the beautiful land of Uganda. But what is the role of young people in building the resilient health systems? Today it's my topic. And we cannot re-emphasize that, first of all, young people, we ought to understand that there is a role we ought to play in understanding the link between climate and health. And how can we understand this? We ought to get knowledge. How can we influence policies? We cannot influence policies from an uninformed point of view. We ought to understand. And right now with COP28 around the corner, so many young people are going to COP28. But what are we going to do? Are we going to lobby, or we are going to also try to create partnerships? As you're creating partnerships and lobbying, you have to lobby from an informed point of view. And the information is out there on UNFCCC website. Capacitate yourself with this information. We are privileged to have 3rd December as the Health Day. This is a pivotal point for us to engage at the Ugandan pavilion, at the same time establish partnerships with different delegations to see that we can advance our agenda at the front line. But as we're advancing our agenda at the front line, what can we do locally in our grassroots communities? Each one of us here represents a community. You all have a point of influence in your community. Thousands of people can listen to you. But what is your role as you stayed up here in this room? Young people, we are innovative, we have passion. And we have seen initiatives in communities failing to groom or blossom because there is no young people involvement. Our voices being mirrored in policies can influence change. At the grassroots level, how can we be innovative? We have digital smartphones. I'm here in Kampala, I can reach someone in Kamuli. Just with my phone, I'm staying in one place. How can we leverage on this capacity? We can use this digital opportunity to build innovative solutions to adapt to climate health systems. And this is via, for example, we can have apps, we can create apps on our phones, and this can be a leverage to help in the building health resilience systems through early warning systems. We have seen telemedicine applications in Uganda. We have Rocktail in Uganda, and this is an innovation by us Ugandan, and it is being a solution at the front line. As my colleague Emma was able to re-emphasize the role of advocacy, young people, we have a voice. We ought to understand that our voice, we keep talking, but we also have to be clear in our messaging. Our messaging ought to be clear that we are advocating for positive change in our communities. We cannot re-emphasize that the future you want to see, you're not going to wait for the government. You ought to be at the front line. Be at the front line advocating. In your advocacy, you'll be able to motivate other people to come and join you. But above it all, building health resilient systems is no longer our talk. It is a necessity because it has become a climate emergency. It affects me, it affects you, and it will affect our future. Thank you.
Thank you very much. Thank you, Doreen. Thank you, our panelists, for those insights on the different topics that we have been able to discuss. Now we are going to take the first 4 hands. 1, 2, 3. Okay, there are 4. So that's all the questions I think we have. I don't know if the person with the microphone has seen those. Yes, so, yes. Okay, so the rest, if you have a burning question, kindly write it on paper and bring it forth, then we'll be able to front it. Yes, who is moving around the microphone?
Very much brief.
Okay, my name's Kabayaga Grace, Executive Director, Empowered at Dusk, Women's Association, an environmentalist by profession, and a key population as well. My issue is about what Dr. Tumukurate talked about. Inclusivity is very key, not only for the youth, but also for the key populations, especially female sex workers and people who use and inject drugs. I may give an example of sex workers who live in Waise. They are affected by floods. And what does this mean? Once it rains, that's when people think of emptying maybe the toilets, and that the waste flashes in water. And where does this water go? In the trenches, which is near their homes. And what does that mean? It means spread of diseases. And another issue goes on waste disposals, like the boveras. If we happen to build a low-carbon, climate-adaptive, and resilient health system, we need to embrace the issue of socio-economic socio-economic issues within our communities. These people use buveras to cook their food. Some person was talking about high rates of cancer among the communities. Now what we need to do, we need to involve the grassroots people, especially female sex workers who use buveras, dispose them even in the soil, and the soil gets detoxinated, and this soil is where we grow crops, which crops again we eat as human beings. Thank you so much.
Thank you very much
Thank
for that
you.
comment.
That was a comment, not
Yeah.
a question. So someone had a question earlier. I don't know whether he still has that question or, okay.
Thank you so much. My name is Stephen Twesije. I am a student at Kampala International University who happens to be still the Deputy Speaker. My question was actually going to somebody in regards to the National Youth Council. Many of the young people have got innovations, but it's so unfortunate that these innovations do not celebrate even a single day of their happening or existence. Why? Because they have failed to meet the right people to talk to, people who can move these innovations. And we just hear from news everywhere that the Uganda Parliamentary Forum on Youth Affairs, their funds under the Office of the President, where young people can go directly and their projects are funded. So I would like to ask, my question goes to the people concerned, that how best should young people with their innovative ideas bring or make their projects to existence, or like to happen in reality, not to just have the ideas and they die in just on papers, but to be implemented so that people can know that, please, someone has an idea, but it just fades off. So I would thank you so much. I would be happy if this thing is taken to consideration. Thank you so much.
Most welcome. Please, anyone concerned, please. That is a very good question.
Yes, thank you very much. I'm Onyango David from the Green Ambassadors Club. I'm a lawyer and a carpenter at the same time. So my question goes to Dr. Christine Jajamtini. She talked about and my question goes to how are we going to be able to eradicate them and us mindset from the people? You know, they always look at us and they're like, you're there and we're here, and those issues concern you. My president from the Green Ambassadors always says that it's useless to talk environmental conservation and climate change to someone with an empty stomach. And so I would love for you to really guide us on how we can try to demystify the idea and the path we are taking towards this and the solution we are suggesting. Because when you read these books, even me, who is a lawyer by profession and someone who has been through school and has been through the system of environment conservation for almost 5 years, I have to consult sometimes. What do they mean by this? Which document is this? The acronyms are so much. NDCCP, PCCC, and so it sometimes just runs through your mind, and we have to keep in mind we are trying to talk to the people that actually have impact here. The old woman in the village who has close to 10, 50 acres of land, and they could really plant the trees down there. So Thank you very much. You would guide us on that.
But you will also guide us on sustainable carpentry, such that people don't just cut trees. Yeah.
Good evening to all of you. My name is Lakot Kevin Kalu, President of African Union Youth Assembly, Global Youth Ambassador, and a member of UN Women UK. I have a few questions. The first one being that, of course, I'm an advocate for African Union 2063 agenda, and we want to see an Africa that is actually industrialized. So my question is, how can Uganda strike a balance achieving economic development levels of more developed countries like China and Japan, because we want to see an Africa that is actually really developed, where we have a lot of industries, but at the same time we want to mitigate climate change and to ensure that there is public health. So how can we strike that balance? Because we do admire these countries like Dubai, and these other countries, United States, but how can we strike that balance? That's my first question. The second one is, I am a youth leader, and one thing I've realized is young people really don't like topics to do with climate change. I don't know if it's because of the jargon that people use when the technical terms that are there when it comes to climate change, or it's just because people are not interested in climate change. So my question is, how can we actually motivate young people to want to involve themselves in conversation to do with climate change? I invited so many young people to come for this event, but I see around only 3 maybe that have come. Yet there are so many that are invited. So they're not interested in this. I don't know how you people can work on that. My third question is, yes, it's the last actually. My third question is, we as youth organizations, we are really trying our best to teach young people things to do with climate. As I've told you, they are not really interested. But we need financing to do this. So most of us, we do not have enough money or resources to actually go out there and do things to do with climate. So my request is, where can young people who have these organizations, because there are really many, where can they go and get funding? Thank you very much.
Thank you very much. We want to be like China and Dubai, where we can take our Habibis. So.
Thank you so much, Crispas. Mine is a piece of information. My very good friend, Semambo, is here. The Ministry of Water and Environment is undergoing drafting of regulations and guidelines on the carbon markets. I would like to invite and advise the private health service providers to take advantage of that and probably make an input, because if you put up a facility that is carbon neutral and is absorbing, because we want to look at the health sector as both as a contributor, but also a victim of climate change. So I think the health sector also can contribute in reducing the impacts of climate change. So the carbon markets regulations that the Ministry of Water and Environment is working on is a good opportunity for the health sector to make inputs and be able to see that we can build a low carbon health sector infrastructure that can actually contribute to combating climate change effects. Thank you.
Allow me please to go back to the panelists and they answer the questions such that we can also proceed to another closing item.
Thank you very much. My mother and my father were teachers. And teachers do not speak to an audience that is not paying attention to them. So may I request, hello? May I request some attention? And we'll do it very fast. I wear many hats. And one of the first hats I have to speak to is the hat that puts the bread on my table. That's PATH. PATH works to leverage African capacity. PATH Africa division works to leverage Africa capacity to address Africa's and member states and communities' health priorities in order to advance health equity through partnership and innovation. And the member from the delegate from the African Union Youth has requested, how do we interest the youth? Organize yourself. Step 1, organize yourself. Step 2, equip yourself with knowledge. This is the knowledge era. Actually, right now, we are overwhelmed by knowledge. PATH works with digital and data, and we are happy to share with you some of what we put together. But number 1, you must organize yourself. Number 2, leadership. Leadership, leadership. Everything rises and falls on leadership. If the youth are not interested, there is a question mark. Who is the leader? When things are not moving, you ask yourself, who and where is the leader? Youth, you are dynamite. Lead yourself. Number 1, Stephen Covey's 7 Habits of Highly Effective People. Victory starts at a personal level. Lead yourself, then go lead others. And when you've led yourself, you'll be in position to rally the youth, and they'll follow you. As Toastmasters, that's another heart. I'd like to pledge with Jude. Jude, I'm committing you and the Toastmasters. We are going to prepare the delegates that are going to COP, all the youth. Set up that Division F Zoom thing, which is 1,000. Put all the youth in Uganda that are going to COP. And I dare say all the youth in Africa that are going to COP. And Toastmasters will show you how it's done. Equip you with communication. The people who rule the world are not people with knowledge, are not people with research, are the people that are able to articulate and communicate on point. And that's what you need to go as African youth to COP28 to do. Communicate on point. Lastly, I would like to say about HCD, human-centered design. And I could say a lot. I'll send what your question was. You know, that is the problem with judges. Eh? You ask them a question, every direction except what you asked them. Because we have a lot to say. UNFPA, when I was still with UNFPA, had a generation-to-generation dialogue. Africa Union and Green ambassadors, you want to know what to do? The judges. The best climate and environment and food security ambassador I grew up seeing was Tata Mukote. Tata Mukote used to wear a kanzu and would walk from Jumbi to Kampala and would ride a bicycle in his youth to Kampala. He would ask us, how many mango trees will you plant? How many fene? And we used to laugh, this guy is funny. But now, in my 60s, I say, what a wise man. He knew food security and environment protection, and he was indigenous, and he didn't go to school. And he helped my dad to build a business in Kampala. I'll write the book from Jumbi to wherever he got. Indigenous knowledge, I think my sister Hajra from Amref mentioned it. Let's not forget the indigenous knowledge. Youth, like Dr. Tumukurate said, you need us. We can be boring, we can tell you stories, but one day when you're 60, you'll look back and say, Jaja Mutini was actually right.
Thank you, Jaja Mutini. So I am just responding to a few questions. I think one was on the jargon. And I just want to inform you that we can't do away with the jargon. We just have to labor to understand, because now we are moving from our silo mindset into the other sector, so we have to put in a lot of effort to understand the NCCD, the UNFCCC, the carbon, la la la. So I think that is actually the problem that health folks have been having, that they get this conversation to be too complicated, but we also get problems understanding the health context. For me, I come from a conservation background, but I must tell you, I was one of the people that designed Dr. Tumukurate's program on health and of people and the environment in the Lake Victoria Basin, and it was hard. One of the problems we got is how you bring different sectors together, then you develop cross-sector indicators, and it was a big problem. But then the project was so successful for around 10 years in the entire region. So we have to labor to enter into the climate space with all that problematic language and jargon that is used, because it can change. And then there's, I think Judy talked about the industrialization. The concern was we contribute less to the global emission, I think around 4%. And then you want us to grow. And then the other ones are already industrialized, growing. So which path? I think someone already mentioned adopting a low carbon path. It is an advantage, by the way, that we are not heavily industrialized. So we have to change the of course, green technologies and sustainability. So, someone talked about the private sector, and this is a very, very big entity that we need to tap into, even all of us here in the room. I think what we are doing as Regenerate Africa, we are supporting businesses transition from corporate social responsibilities into ESG and sustainability. So we are working alongside the CEO Summit. We are hosting the CEO Sustainability Center. And partly what we are doing is finding an entry point on women health into the sustainability strategies. So I think this is also another trend, a quick entry point into bringing the private sector on board. But I think generally we need to think, we seem to be so comfortable in the sectoral seats. So the mentality has to transition into embracing intersectionality. Otherwise, we can't remain health alone, climate alone, environment alone. People just put their own sectors and move along with it. And our findings, by the way, indicate that even some people in the room, or the people who want to integrate at institutional level, they are still in the silo. What are your policies talking about? Are your policies embracing health and the climate? Because we want you also to be convinced the way you are convincing the government and then the climate sector. So I would want personally to, of course, conclude and say, let's embrace intersectionality at institutional policy, practice. Let's keep united, coordinated, and have this kind of a collective voice like we are having, but also informing you that the COPs are just a climax of what has been going on in the governments in the countries. So sometimes you don't actually expect to do much the other side. So that's why I want to bring you down here and say the national processes matter. For instance, the government is actually finalizing the compilation of the government position. How, to what extent have we integrated health into the government position, which is going to inform the regional bloc that Dr. Akadu has been talking about. So if these have been gaps, then this dialogue is beyond the COP28. We have to keep engaging post-COP and probably prepare better for the next COPs. So I think for me, those are critical issues. And then we have folks there who are stubborn in the climate space. They still want evidence. So as we pilot these, do innovations, test them, we need to keep documenting, informing advocacy. That's, I think, something very important. Then we also need to grow our capacities on multi-sector programming, but also look out for all the possible opportunities as entry points to integrate health into NDC's climate agenda, financing. And I want also to warn you that if we are talking about health, let's talk about comprehensive health so that we don't leave out sub-sectors under health like mental health, sexual reproductive health, and other associated entities like family planning and others.
Thank you. I'm going to answer the question that was addressed to me by a colleague. I wish to know who sent this brilliant submission. But my submission, the question was directed to me. I wish to read it out to you. It said, I have seen you elaboratively about COVID-19 under the African Union COVID-19 Bingwa Initiative. My observation is that the AU Bingwa Initiative has not done enough in fostering the climate agenda, yet the climate agenda is a key co-founding factor to that public health. I didn't get the, to that public health hazard, in brackets COVID-19. His question, or her question was, how can the young people bring that question to the African Union level, regional economic blocs, and national stakeholders? First, I wish to bring to everyone's attention what the AU Bingwa Initiative is about. This is a private-public partnership under the auspices of Africa Centers for Disease Control that is capacitating young people across the African continent to be advocates at the front line for COVID-19 vaccination, where I am a Bingwa in Uganda. In addressing his question on how the AU Bingwa Initiative has a role to play, this year we are having the youth pre-conference at the margins of the Conference of Public Health in Africa, which is to happen in Lusaka from the 25th till the 30th of November 2023. Before this, we are having the youth pre-conference where the role is, under the theme, Youth Leadership for a Healthier Africa. And in understanding this, climate change is on the agenda. At the youth pre-conference, we shall have over 200 young people across the African continent who will come and gather to be at the front line in advocating for a healthier Africa. So in answering this question, we are seeing Africa CDC through the AU Bingwa Initiative is capacitating on the young people to be at the front line. And under the One Health approach and Africa CDC, young people can meaningfully be capacitated to advocate. Currently, the African Union COVID-19 Bingwa Initiative is advocating for COVID-19, but you never know. We could further advocate for the health and climate agenda. Thank you.
Yeah, thank you. Thank you, our participants and listeners, for these questions. For me, the key issues hinge around inclusivity and how can ideas be supported, especially from youth. Those questions came up. Generally, in responding to this, there is an African saying, it takes a village. These things of climatic change cannot be handled by one individual or one country. Our panelist has said that actually we are responsible, developing countries, Uganda included, for 4% of the current global emissions, meaning the problem is global. Global challenges, global solutions. Start locally, start with me, start now. To me, this should be the adult. But what does it take for health? Let's bring awareness for everybody to see climatic change, environmental degradation as impacting their own lives. Let it see to be in our lives, in our pocket, in our health, and the longevity, the life we spend on this world. If everybody knew that, then we would know that these issues are public goods. Of course, let people know key actions. What can I do as an individual? Surely, I shouldn't start littering, especially plastics, which we know will degrade the environment and there will be no food security. Probably I would be against open defecation, which will send diseases around. And probably, if I had a chance in my compound, I would plant a tree. These are some of them. But let's be clear about this. These are not enough. They are way, way, way insufficient. However, we need to really have a way of supporting those who have the opportunity to read positions that have influence at the National Planning Authority, maybe reading any projects who have recipients of resources, help to have a national response. It all goes with a national strategic plan. We have, of course, National Planning Authority that guides other sectors to plan. We have human capital development that links health sector and services together. These are very good. Now, if that happens, and then those credible plans are going down, we should be able to demonstrate to ourselves that things can be done. Indeed, there is hope. My colleague here has appreciated the work he did on health of population and environment. That was a project way back. Health, population, me and her and him, then our environment. These are interlinked. It was a success. What has happened thereafter? So, it can be done. What's lacking, though, is that we need to kind of have actions at all levels, as we have said. Some of these don't need money, probably. Yeah? You don't need really money, somebody to guide you that you should not litter. But others need kind of macro planning. We are all going to go. Many of you are anxious for the right reasons. You don't know how long it will take you between now and your home, which may be just 2 kilometers away because of the clogged roads. You know, how are we going to go? Many of you are going by cars or are going by whether, you know, public or border, whatever. Whatever you are going through is not a transport that is carbon neutral. Is it? No. But I can't build an electric train service. I can't even probably, maybe I can afford an electric car or a bicycle. But KCCA can mobilize money to do that. So what can we do? We can hold the KCCA accountable through saying enough is enough. This way of transport must be given an alternative in time frame. So even the activism that has been talked about need to be guided. You don't simply walk on the street without a clear call that will have public dividends. In health, resources are probably not enough. And we will need more. With this flooding, with these epidemics, we need more. Who are advocates for health financing? Who are holding the people, the budget holders to use the resources well? Indeed, who are ensuring that these innovations for younger people go to people with credible projects? So it's a whole lot of work. I can't say more than this because more is needed. However, there is hope. We can do it. Let's keep coming together, sharing ideas. Next time, we'll be sharing what we are doing individually. It goes up. Then let's hold at a global level those people accountable. They have spoiled the world group. They should be part of the solution. They should, under global partnerships, under equitable considerations, they are mandated and must. They said there is a lawyer here. Has he gone? Yes. These people that have read the environment how it is, that has led to that Rwenzori peak to lose its glacier, must be held accountable. They profited from it, they should. However, that's not an excuse that we should follow the same path. So in conclusion, we can go carbon neutral with green energies at our facilities. We can support it across, because health is cannot be enough to restore carbon neutral, no. Some of these need to be general and health also adapts them. We must be prepared in health to get more money, resources, to support more diseases and health conditions that will come. But we also must, that's the resilience system, but we also be part of the society through awareness to create an environment that is, and a system that restores and maintains our environment and the climate. I would like to stop here. Thank you.
Thank you very much. Another round of applause for our panelists. Yes, just adding to their voice, teamwork is the secret that makes common people and uncommon results. So, and I appreciate that that's what every speaker has been alluding to, that we need to collaborate. So let us maybe get a photo moment with all our panelists. Unfortunately, most of them have gone, but we can have a photo moment with those who are around. Yes, and then over to you, MC.
Thank you. Thank you so much. Thank you so much. I think we can have a photo for our speakers, even the previous ones. Can you join? But do we still have the speakers? I don't know. So after that, we shall have a poster presentation from Reproductive Health Uganda, and strictly, they're going to use 2 minutes. You can be our timekeepers, please. So please organize that presentation when you are done here. Please, someone representing Reproductive Health Uganda, 2 minutes. 2 minutes. After that, Dr. Charles Pate will come and invite leaders to give us closing remarks. Please.
Okay. Good evening, everyone. My name is Duncan Muhereza. I work with the Reproductive Health Uganda. They have been talking about partnerships, and I want to showcase a simple innovation that we have been using as the Reproductive Health Uganda, as they have told me in 2 minutes. I don't know if you're going to, briefly, our Reproductive Health Uganda, we are working with the WWF in partnership to implement interventions in southwestern Uganda. And our panelists have been alluding to us, that it is vital to have partnerships, to have successes of interventions and the projects in the communities. We are working with local leaders and religious leaders, and this one can, yes. So I was sharing that these are structures that exist in the communities, and these are people that hold power, the religious leaders, cultural leaders, and other opinion leaders. So in our intervention, we trained the cultural and religious leaders. These are the people who have power to speak to millions of people each day or even every weekend. And we leverage on that potential to work with them and show them how climate change can be integrated in their routine activities, and this is our approach. Briefly, you can go to the next slide. These are some of our training sessions that we worked with the religious leaders and cultural leaders, and that is one of the cultural leaders who has put together groups of community people trying to speak to them about climate change and their interlinkages with sexual reproductive health. So like this one I talked about it, that we have been working with the WWF. These are our partners who do conservation. And for us, we come with the GTA approach, where we integrate conservation, health, and climate change response. So these ones are not dwell so much about them, but it is this intervention of community empowerment that we empower these leaders who are the grassroots people, and these are the people who have power and influence to speak to thousands of people in their routine activities. And this one I talked about it, that we have trained around 60 cultural leaders in Kasese, Rubirizi, and Kagadi. And we are also creating partnerships with the cultural institutions like the Obsinga wa Rwenzururu and also the Kingdom of Bunyoro, where we believe that their call onto the public can really give us a milestone to have them influenced and leverage on some of these interventions. So in conclusion, we realize that people are starting to appreciate the interlinkages between sexual, reproductive health, and climate change, though it is still a complex topic to speak to people. In our engagements, it is really complex to speak to actually some of the even technical people at the local governments to understand the linkages between climate change and health, like most of us have been talking. But I want to conclude by saying that, like so many people have been talking about partnerships and innovations, it would be prudent for all the organizations and the CSOs that are here, including the government, to have an umbrella that can bring us together, say an alliance, because this is the talk that has put all of us together, because we are preparing for COP. But after COP, what is going to happen? So it would be prudent to share and learn from what all of us are doing. Because as RHU have showcased this, it could be something that would work maybe for AMREF, something that would work for, say, Yardinet, but because, like some people have been saying that we are working in silos, it would be complex to understand that actually there are some even innovations that are happening that you can borrow and learn. So I would want to challenge all of us that we can have an umbrella alliance for organizations in Uganda that come together for the cause of climate change, and this is how we can always have such meetings and sessions that can bring us together, not waiting for COP or other international meetings that we would come and discuss, and then it ends there. I want to thank you so much.
Well, thank you so much, Reproductive Health Uganda. Responding to one of his call of bringing together organizations. Under the Ministry of Water and Environment, the Climate Change Department, we are forming a youth umbrella body, a coalition that is uniting youth-led organizations doing climate and environment work. So if you know that you're doing climate and environment work, please, we have put out a call to unite, that is calling for organizations to subscribe to this coalition, look for it and feel it, such that you also be under this coalition. I want to invite the next presenters. Please do that in 2 minutes. 2 minutes. Who is presenting? Please. Okay. You have 2 minutes.
So thank you so much for the opportunity. Well, we are from the Uganda Malaria Youth Champions, and we are doing more around malaria, but it was imperative for us to link malaria to climate change. And as a youth-focused organization, we saw it more appealing to give an inspiration to what we are doing on the other end of malaria, to what some of the climate activists can do this side. Because as you can note, we have the big issue that has been around was the fact that young people are alluding to the fact that we don't have money. We we don't have funding. Yet on our end, it's the same problem, but we are trying to utilize the few resources we have and probably leverage on what we can use in terms of maybe innovative, simple solutions like online campaigns. So with us, we just have a one-page poster presentation to just really inspire the young people in this room to what they can really do around climate change activism. Number one there, we are talking about the community-led impact. And this really involves going down to the grassroots, and you have real communication with the people that are impacted by the adverse effects of climate change. And for this particular one, we were looking at malaria. Number two, we were looking at small innovations, like small fundraising innovations, like we had the malaria walk and then the medical camp at the Parliament of Uganda, where we managed to raise over around 20 million Ugandan money that shall be utilized by the key partners that arranged that walk. Then down on the far left, we have a capacity building platform called the Malaria Youth Roundtable to just really build the capacity of the young people so that they can be, number one, informed. Number two, they can have the networks and then the connections they can utilize to do their advocacy. This last on my right is our innovative online sessions. We do recurrent Twitter spaces and webinars every month, and we do it in partnership with an organization called INASO, so young people can really evaluate that as well. Of course, there are many ongoing Twitter spaces, but try to focus them on what you really want to achieve. And then the last one, I won't mention everything, the last one is really doing the community outreaches. There we were at Cholera Market trying to do drainage of the trenches so that we can reduce on the breeding places for the mosquitoes. On our advocacy, we evaluate the media spaces. We take advantage of the television airtime and the radio airtime to really reach out to our target audience. I think I would love to end it here in the interest of time. Thank you.
The last person is from Makerere Public Health Institute, School of Public Health. Sorry. Can we project their presentation, please?
Good evening, everyone. I am Patience Oktan from the Makerere University School of Public Health, Department of Environmental Health and Disease Control. I'll start right away. I want to thank everyone for this symposium. It's really been so great and educating to each of us, especially us as the youth. So my topic of research is on the impact of climate events on the health and well-being of forcibly displaced persons. So we realize we've been talking about youth and children and women, but we've left out that aspect of the vulnerable people. So here, who am I targeting? The vulnerable people would be the possibly displaced people. Those are the refugees and internally displaced people. We realize that in Uganda we've had so many events on flooding and droughts where people are migrating from one place to another, but we have never gotten to know how their health has been impacted, especially psychologically or mentally or even their physical well-being. Most of the issues that we highlighted on the WASH effects, everyone has been talking about them, the mental health, the physical health, the deaths, the injuries, but also there were lots that were highlighted on the WASH sector, water, sanitation, and hygiene. So my remarks here, because I support a team at Makerere University School of Public Health to do research in climate health, I would pose a question to all of us. How are we going to integrate the health workforce into climate change? Recently, as we were carrying out the VVA, I interacted with one of the health workers and was telling me about the retention at the health facility just because of the heat waves. This was in the district of Bulisa. I know Bulisa is very hot, and the surveillance officer was telling me there are so many health workers who are leaving their jobs because they cannot cope up with the heat waves. And so how are we going to handle this as the health sector? And secondly, I want to highlight something to do with the carbon credits. As the health sector, how are we going to intervene or implement any projects in the health sector in regards to carbon credits? Thank you so much.
Thank you so much, Patience. At this point, allow me invite Professor Dr. Charles to give a vote of thanks and invite Mr. Didas, Dr. Didas, to give the closing remarks. We shall ask Doctor to use only 1 minute.
Thank you. First of all, thank you for today, for the first time being referred to as professor. I'm Dr. Bate, but yes, for those who are referring to me as a professor, just to correct and say I'm only Dr. Charles Bate. Thank you very much. Not that I do not take the blessing, but just to make sure we have the titles correct. My job now is very simple, is to say thank you to all of you, to one, our partners that have worked tirelessly with us to organize this event. Second, to all people who have contributed ideas, posters, presentations, thank you. And lastly, to all participants who have participated today and also contributed ideas to the work we are fostering on building climate resilient systems. Service providers, the media, we are really grateful that we've had you here today. So, thank you very much. Now, in the 15 seconds left of 1 minute, allow me to invite Didas from the Ministry of Health to give the closing remarks on behalf of the Commissioner who had to leave early, and also to officially close this event. And from me and from my team, really thank you very much.
Everyone is very tired and you want to go and join the jam. Let me introduce myself well now. I'm Didas Namanya. I'm a senior health geographer, Minister of Health. But now I'm also a commissioner. So I will not do it in 1 minute. I will do it more than 1 minute. First, I will give some few remarks, brief remarks, and then I will read the speech, closing speech of the Commissioner. Ladies and gentlemen, let me say I'm extremely humbled that today, for the last 20 years I've been in this space of climate change and health, I think this is a high moment for me. I think we can give it a gift clap. This is because for so many years, we have been discussing climate change. We have had fights with the environment, water and environment, to make sure that health is in the front line. And today, I can see that coming. It has started coming. Not only nationally here in Uganda, not only regionally in East Africa and Africa, but also globally at the UNFCCC level. We are there, health is there. And when I talk of health, I mean everyone here because everyone here needs what? Good health. Therefore, I'm happy for all of us that at last we are on the top, on the agenda of climate change in the whole world and in Uganda. That's one. Number two, I want to remind us about the theme of today. In my opinion, I think we have achieved what the theme is talking about. But this theme is projectory. It is telling us what we should do in order to achieve something. Building a low carbon, climate adaptive, and resilient health system in Uganda. I think with this as a background, as a starting point, we shall be able to achieve this theme. Now, let me read the speech of the commissioner. Of course, the commissioner was observing protocol. I'm not going to read all the people who are present here, but I want to acknowledge tree adoption, which has taken lead in this process. Representatives of MDS, Ministry of Water, all the ministries which are present here. The Rockefeller Foundation, which has helped us to take another step of doing the VAA. And of course, all the CSOs and NGOs which are here. And the media. The media, you are highly appreciated because you are going to pass on the message that we need to have out there for people to understand. So ladies and gentlemen, I'm now reading the speech. I would like to thank you all for actively participating in this first ever Health and Climate Change Pre-COP Symposium. This is the first one. As you are all aware, health is one of the thematic areas in the COP. This is a great achievement as it raises the profile of health and climate change globally, nationally, and regionally. COP28 provides a unique opportunity for the Ministry of Health and all its partners to leverage global partnerships to support the actualization of a sustainable, resilient, low-carbon health system in Uganda. To emphasize, what do we mean by a climate-resilient and low-carbon health system? These are health systems that are capable of anticipating, responding to, coping with, recovering from, and adapting to climate-related shocks and stress, while minimizing greenhouse gas emissions and other negative environmental impacts to deliver quality care and protect the health and well-being of present and future generations. That's what we want to achieve by that theme. Ladies and gentlemen, let me take this opportunity to thank everyone for the contribution towards developing a strong health and climate position paper. We have participated already in this position paper. All our ideas will be synthesized and packaged into the health and climate position paper, which we are going to present in COP28 in Dubai. Finally, I want to acknowledge everyone, MDS, all these people. I'm not going to mention them by name. The logos are there, but even if you are not here presented as a logo, we really acknowledge and appreciate you. Finally, it is my great honor and pleasure to declare the pre-COP Symposium officially closed on behalf of the Commissioner and on behalf of the Ministry of Health for God and my country. So over to the MC.
Now that you've been told to go home, you can go home. Thank you so much for coming, and we hope to see you in our future engagements. But let this conversation not only stop here, but let us continuously engage on health and climate change issues. Thank you very much for being a wonderful audience. See you soon.